take us through. So welcome, Dr. K.K. Deepak Agrawalji. The stage is all set. Pallavi, you could assist with the PowerPoint presentation. So due to the limitation of time that we have to complete all these today's various sessions, I would request that the time limit of 15 minutes is there for our guest speakers, and if we could
right.
Make
so, is the screen visible? Okay, right. So thank you so much for the opportunity. And the first thing I would like to clarify, my name is misspelled. I'm not Agrawal, only KK Deepak. So somehow this name has gone into this. My screen also showing the same. So anyway,
so we are very extremely sorry, sir, for that.
I'm
extremely sorry for that.
That's why I'm having a problem of getting this connected. So there's one Dr. Deepak Agrawal at AIMS, so maybe you clip
sorry
that. So, he's also from cardiology and some other.
Okay.
So thank you so much for the introduction. I'm going to talk about in the next 15 minutes the physiological variability and how to quantify it. The next is please. So what we've been doing for last over 30 years clinical testing using organ function tests, research, capacity building, technology development, and database development since 1989. Next. So contribution to HRV measurement has been that we published a paper, very important paper. I was working at AIMS and we collaborated with IIT Delhi, that the pulse measurement from finger we measured by PPG, photoplasmography, is the same as, it gives you same HRV as what you do from ECG. And that becomes a big hit because then for doing HRV, you need not to have 3-lead ECG. You can very well get by any device. So that's what this was a big thing which has happened. Next one, please. So what is autonomic tone and what is heart rate variability? Is that when we are alive, our heart is pumping all the time. So the beat to beat interval is variable in order to adjust your blood pressure to keep the blood pressure constant. Therefore, at rest, when you are healthy, your beat to beat fluctuations are seen, your heart is oscillatory. And it's beautiful oscillatory. So your heart rate is not constant, and that's what the normal thing is. What happens before heart attack or before any problem in hypertension, the heart rate almost becomes stable, maybe at higher heart rate. And therefore, whenever you get a shock, whenever you get an insult, or whenever you get a fall in BP, the blood pressure is not corrected properly. So the two variables, heart rate should be oscillating. That's what you can quantify by HRV. We developed a software for that. And blood pressure should be quasi-constant. So blood pressure does not show fluctuation, and that's what the important understanding for people, those who are using it. Next one. Next. So this is what is being shown. Blood pressure is shown in above and heart rate is being shown in other. Since our blood pressure is being controlled by various mechanisms, some internal, some external, some emotional, some physical, there will be tendency to change, like standing or lying or sleeping. Now, this tendency to change because of external factors or maybe internal factor is being corrected by corresponding changes in heart rate. So if your blood pressure goes up, heart rate will go down and will correct it. Blood pressure falls, heart rate will go up, and then that's what you see whenever you get some kind of a sudden standing or sudden jerk. Next one, please. Next. So here you see a diagram which is showing that heart rate from one beat to next beat is not constant. Next one. Next. Yeah. So how to quantify it? It's very simple. Those who know the statistics, if you give me the series of changing variables like heart rate is changing, I can find out standard deviation. I can find out change around mean. So they are time domain. Or you can find out how frequency, what frequency it is changing, and that's being done by the frequency domain. And even the non-linear method can be used. to find out simple from one beat to the next beat, how it is changing by using a non-linear simple method, the beat 1, beat 2 correlation. If you plot beat 1, beat 2, it will give you beautiful scatter, which is a normal scatter. Next. So these are some of the measures from time domain measures, and we have published several papers, and you can find much more description on them. Next, please. So this is the frequency distribution. This is important to understand. When you plot a curve, you get high frequency, which is seen on the right side, which is a larger peak, and low frequency, which is seen on the left side, which is a low frequency. So this high frequency actually tells us our vagal function, the heart, the healthy function, how our heart rate is controlled by the vagus or parasympathetic, which means when you relax, that point of time you get the higher. And when you become tense, you get the higher peak on a lower side, which is sympathetic. So you can quantify sympathetic and parasympathetic output from this simple measurement. And that's why this becomes a beautiful tool to quantify how much stress are you under. Next one, please. Next. So high frequency, as I told you, parasympathetic, and it has respiratory influences. Here comes that when you do a respiratory manipulations, a slow deep breathing, you also change your heart rate. And normally at rest, this is under respiratory influence. And therefore, this can also be used for quantifying the vagal input to the heart. And so it's called parasympathetic function. Low frequency, predominantly sympathetic tone. Under stress or under challenge or threat, you get 0.1 hertz. When our vessels also start oscillating, 0.1 hertz is when vessels are oscillating. They are under stress. That's why you get a kind of a hypertension episodes or increased sympathetic tone and so. And there are some other frequency which can be used to determine other functions. Next one. So we developed this software, HRV soft and BPV soft. And next one, please, with the help of IIT. Next one. And we distributed to the several centers in the country, and we did external validation and found that it was as good as any other software, and that's why we tested, validated with the software. We generated large amount of data. Not only we did generated data and validation, we also did a capacity building. Several people were trained how to do HRV and other. Next. And so we developed a cloud-based system. It's called chrv.dic.gov.in. And this is Government of India supported. The beauty of this, that if you upload your digital file of heart rate, and then it gives you the heart rate analysis. Therefore, it's free of cost, which we generated with the help of Digital India Corporation. Dr. Vishal Mane from Pune, now he's in Pune, earlier he was with us, developed help in this system. And it's being supported and hosted on GOV site. Next one. And not only this innovation, we did several other innovations, like we developed NIBP, non-invasive blood pressure monitor, with the help of IIT. We published one paper also, and then several other innovation which can also use to modify the human physiology, and we can determine. Next one, please. And this is a paper published for blood pressure equipment, because you can do a continuous blood pressure monitoring. So when you want to quantify autonomic tone, it's important that you quantify both the parameters. Next one. And so these are hardware, software. Next one. So we trained several people, several students were trained, and several of them are faculty member across country and abroad. Next one. So how do we connect with the past? So how much time do I have? You have 13. Okay, I still have 5 minutes. Okay,
Yes,
so how to connect with the past? Next one, please. So the teaching system in medicine is very old, much older. Unfortunately, many of the Western books have never documented this kind of achievement. Next one, please. So we had a golden era around 500 BC, and there were all systems available, different departments available to teach and train. There were complete setup systems of medical education in the ancient world, but the world has forgotten all this. Next one. Next. And so Atharvaveda is that the textbook which actually describes all about it. What we're talking about today, what Mother Bog is talking about today, everything has been described, like how to increase longevity, treatment of ailments like heart attack and other things, cures of specific disease, eradication of germs, antidotes to the poison, prudent food habits, and healthy lifestyle. We have actually lost so much of information in the posterity. Next one, please. Next one, please. So when I was hostel superintendent 2019, I gave that the hostels all should be labeled by the ancient physicians. So if you come to AIMS anytime, if you see the hostels are named by Atraya, Agnivesh, Ashwin, Charak, and all those. So it's a beautiful thing which has happened on the campus of AIMS campus. Next one, please. Next. And these are the hostels situated across the campus. Next one. So that people are aware of the Ayurvedic tradition. Next. 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 So some of the hostels which were inaugurated in front of me. So this is a Kashyap hostel which was inaugurated in 2018. Next. So these are they have contributed a lot. Here you can find several mentions what kind of a contribution they did. Next. So how did we contribute to the advancement of this topic of the world? Next one. So we took a full-blown study. This is several studies. I'm starting only 2 studies here. And we try to find out in the daytime how our respiratory rhythm changes and how our autonomic tone changes. And we recorded 5 times: 5 o'clock in the morning, 11 o'clock, 2 o'clock in the evening, and again 11 o'clock. And then we found the circadian rhythm of sympathetic tone variances was characterized by the gradual increase and corresponding reciprocal changes in vagal tone. So there are my sympathetic tone changes. That's why you get most of the heart attack in the morning, early in the morning. And therefore, that is time is high. So if you control that by vagal, by doing a morning rituals like, and then you get. So this was a reverse relationship which we have reported. This is a beautiful paper cited, already been published in Chronobiology International. Next one, please. Next study we have a various types of Ayurveda, Vata, Pitta, Kapha. So do they differentiate from physiology point of view, physiological variability? We also know that people are physiologically variable. Some people are sympathetically reacting. Some people are parasympathetic, calm and quiet. And we have earlier published some other work like vasomotor rhinitis and atrophic rhinitis. Different people get different type of this thing. So we took up a big study. We scanned most of the colleges around Delhi and tried to find out, to explore and understand autonomic tone among Prakriti classified healthy individuals. Next one, please. And we found beautiful results. And this paper has been published in Physiology Reports. So most of the details are available here. It's a multi-centric kind of a study. We took help of several institutions like IGIB and IT Madras and AIMS and other places. Next one, please. Next. So, and the 2 places the study was conducted. That is, one is the northern part in Delhi and one in Vadu in Maharashtra. Next one, please. Next. We found the 3 people, they differ when we give a stress like head up stress. So to make a person stand 60 degree and then see how their blood pressure is falling and how heart rate is changing. And therefore, we found very different results in among them. Next one, please. Next one. This is the same in a table form. Next one, please. So the kapha type people had a significantly lower range of in heart rate, LF, NHF, and LFHF ratio, response to head up tilt. So lowest autonomic reactivity. They were not responding to the challenge. They should respond. That's what is important, that when you stand up, your heart rate and other thing goes up. So they were not responding. The relative change in heart rate and parasympathetic parameters was significantly greater in Vata than Kapha. So Vata was responding. So this is what is important, that who responds. So this becomes an important finding when you're thinking of who is healthy, more healthy or less healthy, and what type of intervention you should take. What do you what do you prescribe, like breathing practices or other kind of a thing? Next one. Next one. So the another conclusion was non-linear analysis when we performed of autonomic tone in Prakriti classified healthy individuals suggested lower parasympathetic modulation of HRV in a Vata cough, Prakriti good type. So they were so to sort stable person in this regard. Next one, please. So if you see the health, it is a continuum. The good part is that only few people of us, like less than 10%, are poor health. Most of us are healthy most of the time, and that's what we should remain. So we should enlarge the good health domain and convert this to a more healthy, like top athletes and other healthy, and reduce the red part which is there. And this is what can be done by integrated approach. And all Ayurveda, allopathy, they all intend to actually increase the good health part of us. Most of us should remain healthy most of the time. And by increasing, I happen to be chairman of Fitness India mission of Government of India. We prepared the fitness protocols which are available on website. They give you how you become fit. They also give you a protocol how you can quantify your fitness. I should know my fitness today, and after 6 months, how fit I am. And that's what can be done. Next one, please. So this is what current and Ayurveda they should come. Once upon a time, Ayurveda was a conventional treatment. Now it becomes a non-conventional or alternate therapy, but it's a matter of time. Next one. So some suggestions, the government and other things, the prescription policy and inclusiveness of complementary medicine in Ayurveda. So we have been trying to push it hard that some kind of a quasi balance should be found out. Next one, please. The left side book we published on physiological variability with the help of BARC, Bioatomic Research Center. And the right side was published by my seniors long back, 74. And that was a science and medicine of physiological concept in ancient and medieval India. And they gave it more. So left one is more physiological, right side is more philosophical. Next one. So the important is that kind of a balanced attitude between the two. So how can integrative medicine can come? The development of scientific attitude among person involving complementary medicine. So those who are working on Ayurveda should become a little more scientific. When they do a study, when they believe, when they talk, and when they argue. It's not that useless arguments should be made. It's all science we are doing it. On the right side, those who are practicing the allopathic, like me or other, they should develop an aptitude of inclusiveness. Like, okay, we are good, we are successful, but some other people are also good. Give them a try and include them in whatever percentage as of now permissible, and help them to become scientists. I've been conducting workshops for yoga people, how to do research, how to collect data, how to talk about science. It's important how to talk about science. Many times, many platforms, they do not talk about science. They argue, but that's not the science. Next one. So important is problem is in integration. Problem have been ignorance, a belief, faith, and ego. If you put them together, that's how it's been a problem of this non-integration, which has been over 1,000 years. Let me talk about. People have talked. Thank you so much. Thank you. So I come to end of my talk. Thank you. I can leave it. Thank you so much.
Thank you, sir. Thank you for enlightening us and showing us that heart rate variability can be associated with our day-to-day life also in such an easy way, by showing it its relation with our dinacharya, by showing it us the relation with our prakriti and the way of our prognostic progress. So thanks a lot. Thanks a lot for the great presentation, sir. So if any of our further presenters want to ask sir a short question, they can go ahead, or we can continue towards our next dignitary.
Dr. Suhas sir, I have a question, if you
Yes, sir.
permit.
Yes.
The Deepak, Dr.
Yeah.
Deepak sir, sir, thanks a lot for a very wonderful presentation. At Madhavbag Doctors, we are conducting like a 50,000 cardiac stress test in a year, and
Okay.
more than 1 lakh ECG we are continuously reading. We are doing CT angio. So we are using all the modern parameters to understand
Very
the
nice.
and diagnose the cardiac ailment.
Very
A
nice.
heart rate variability is very unique, but we have a few questions in our mind. So I would like to ask that question is the if someone is coming to my clinic with a heart rate variability, so and if I want to give him assurance ki, okay, by this treatment I help you to correct your heart rate variability. So as a physician, what assurance I can give to a patient ki how much time it will take to correct the heart rate variability?
Very nice. Very nice question. So, two things to be done. First thing, how much time it will take?
Hmm.
It will take the same time when you see the training effect in exercise. So, roughly 4 weeks with some changes, you can see up 6 months,
Hmm.
you will see full blown changes. We did a study. Every 6 weeks we measured. We saw changes in sympathetic profile by 2 weeks or 3 weeks, like response to blood pressure. Vagal tone comes about say 5 months or so beyond. It's a
Okay.
permanent effect if you change some. So this
Okay.
is the timeline. Somewhere along, there are four components in fact: sympathetic reactivity, sympathetic tone, vagal reactivity, vagal tone.
Okay.
You give a stimulus, how do I react for my heart, or how much is heart rate at rest?
Okay.
That is permanent. That is what is should be seen. 6 months. Now,
Okay.
second thing, when you look at the patient, why patient has come to you and why you are talking, that is important.
Mhm.
They have come for heart attack and some other acute problem, and then we are talking about HRV and other thing. You're talking about fitness and well-being. So they should also change. You should also change that. You should be more fit so that you will not get a heart attack,
Okay.
and that takes longer time. So HRV should be seen more as a fitness parameter than immediate diagnostic parameter.
Okay.
A second, if you want to see a diagnostic or prognostic, then it should be seen a prediction or prognostic parameter. What has been shown that if you got a poor heart attack, if you got a poor HRV, and you had a heart attack, suppose you can predict second heart attack.
Okay.
This is what the strength lies. But that's a prediction part. Many people come to the hospital only for the treatment of immediate. Some care about the prediction. Some hardly few people care about the actually regaining the original health which was there 2 years ago. So
Okay.
Madhavbog is doing wonderful work as I see the profile.
Mhm.
You look at the overall holistic approach on health and the diseases.
Okay.
Thank you.
Thank you. Thank you very much, sir.
Okay. So thank you, sir. Thank you for the presentation. And uh, during the conclusion of the earlier session, we talked about integrative treatments and integrative health, and who more would be better to talk about integrative health. So I'll welcome our next guest lecturer. Welcome, Dr. Bhaswati Bhattacharya ji. And to introduce her, it's a exhaustive list in front of me, but I'll just pick few lines to let you know that how lucky we are to have you. So, Dr. Bhaswati ji is a clinical assistant professor of family medicine, Weill Medical College, Cornell, New York. She also happens to be Chief Science and Research Officer, Veda Farms, New Jersey. Apart from that, she is a physician and has solo practice also. She is also a Fulbright specialist and is associated with U.S. Department of State, and also uh, was appointed as peer-reviewed appointment as consulting expert in global public health, and that also in accordance to integrative health. She has a vast experience as teaching faculty across various colleges, and she is also the founder director of the Dinacharya Institute in New York. She also happens to be the director at the Indic Academy, Hyderabad. And apart from that, she is a health and medical consultant in the Basmati group of health as a also being part of the New York. So yeah, I may have left a lot, but there is also a lot that I talked about, and I will not take much time. I'll invite Basmati madam, and I'll hand over the stage to her. And really excited for the second session. Thank you.
Thank you very much, and welcome to all of you. And I will share my screen. So today I've been asked to talk about how to integrate Ayush practitioners onto a global platform of cardiology. And this is actually a topic which is so vast. There's so many things that we could focus on. So I've just chosen a few, and I'll leave some time for questions. I am trained in biomedical. This is where I started. On the left side are my gurus and mentors. And in Ayurveda, we always begin with obeisance to our guru, Guru Brahma, Guru Vishnu. You all know the stotra. But in the middle of my career, after becoming a pharmacologist and neuroscientist at UPenn in Columbia, and then working in public health, I made a film it's on the Discovery Channel. I made a film on Ayurveda. And my journey is as much a part of this story about integration, because I realized that in my black bag of modern medicine, I couldn't do the things that I came to make that film and I saw were possible using Ayurveda. So suddenly I saw that Ayurvedic doctors were doing things like Thirumulpatji, and here you can see from AVP Coimbatore, Krishna Kumarji, who is my Diksha Guru, is. And then when I was at BHU for my PhD in Ayurveda, Chandrabhushan Jadi. So I found that these people can do things that my black bag in modern medicine cannot do. And it created a kind of difficulty for me that what do I do? I have been integrating the two for many, many years, because ultimately I'm not a doctor of modern medicine or a doctor of pharmacology or a doctor of Ayurveda. I am a person who helps my patients. And what that requires is a full integration, which is exactly what many of the doctors who were presenting for the last 3 days and also today will be doing. So the question about how to integrate, these are some of the answers, and these each could have a very robust discussion about what we can do, how to do it. And I'll just share some slides from the internet to demonstrate some of these. But I'll just, actually, I think I should do that first because it's more quantitative and it'll be I think better for people. So I'm going to share some slides from the internet, and that looks like this. So I put this up just now because of Dr. Deepak's talk. I was in California when heart rate variability was actually discovered as a form of biofeedback, and it was considered to be nonsense by the allopathic doctors. It was considered to be a measure that takes what's going on in the mind affecting the heart, and they thought that it was a bunch of pakwas. The best allopathic physician said, how can this be? You know, this is, we know that the mind can affect things, but this heart rate variability. So this man named Doc Childre, this is actually the origin of heart rate variability, and it was actually not believed in because it had too much of that non-scientific stuff. So a bunch of us were asked to go into this, and the history of heart rate variability then being taken up by the people in the modern medical world and co-opted, which is what happens. Modern medicine laughs at it, makes fun of people for doing these, and then suddenly they realize, oh, there's a science behind it, and suddenly they pretend like they had it all along. So I was very curious how heart rate variability has now become the basis of Nadi, Tarangini, and Veda Pulse, and all of these other bases that we use. Any one of us who has actually learned Nadi Pariksha knows that it is best done by humans and not by electronics. I'm saying that because I've done so much background in this. And in the US, we actually train people in the Ayurvedic schools how to do Nadi Pariksha rather than training them how to do the electronics, which they still don't have in the BAMS curriculum. So I think that's an interesting thing about heart rate variability that we can discuss. I've been asked to talk about how to integrate on the US platform. So I should start by saying, first, we should go to the places in the US that talk about heart disease. As many of you know, heart disease is the leading cause of death in America. So if you go to heart.org, this is the American Heart Association, and they will teach people all about heart disease. My vision is to see the mother bug protocols included in these health topics. Because if you read most of these things, you know, adding color to your food is the kind of level that they're talking about. They have no idea about Ashtanga Hridayam, Sutrasthanam, Dravadravya Vigyan, or Annaswarupa. They don't know any of these. But this is there, and this is what they're trying to teach people. And heart disease is still the leading cause of death. So I welcome you to go here and get a sense of the limitations that the US population have, because they do not have the protocols that Mother Bug introduces. And that's not just true in the US, it's also true of the modern Western kinds of people that go to the majority of allopathic doctors in India. Second website that I encourage you all to go to is to understand the National Institutes of Health. This is the equivalent of the Ministry of Health and Family Welfare in the Indian context. In America, we don't have ministries. So we have institutes. There are 27 institutes that you can see along this side here. And each one has something to do with some aspect of health. So the one that is most relevant to heart disease is the National Heart, Lung, and Blood Institute. And of course, there are others as well, because we've seen many presentations that have to do with diabetes. So there's you can just scroll down and see there another institute on diabetes. There are other institutes on different topics. But if you go to the National Heart, Lung, and Blood Institute, you'll see there's a huge amount of research that's done to promote the prevention and the treatment of heart disease. And they will give you lots of studies, and you can actually join their mailing list and find out what's going on. Now, I can talk about each of these from an Ayurvedic point of view, as I'm sure all of you can. And the important thing is to take the research that Mother Bug is doing and introduce it into language that people in America can understand. I'm at Cornell Medical College, which is here. It's in the Upper East Side of New York City, Manhattan. And we have, obviously, like many hospitals, a program on heart disease diagnosis and treatment, and all of the attendant diagnostic techniques that were just discussed a few minutes ago, that Mother Bug doctors use for their patients. If you go to the US News Report, which is one of the big magazines, they talk about the best hospitals for cardiology and heart surgery. And what we see is that we have lots and lots of well-known places. Most of you have heard of Cleveland Clinic and Mayo Clinic and Cedars-Sinai in Los Angeles. This is my hospital, New York Presbyterian Hospital, which has 2 medical schools, Columbia, where I graduated from, and Cornell, which is where I'm appointed. And it just goes down, and you can continue. Mass General, most people have heard of at Harvard. So this is the kind of prestige that they hold. And for me, of course, I am a little bit, what shall we say, skeptical, because I really find that the people that claim to be the authorities really don't do the work of being the expert and actually solving things. So, of course, I admire what's going on with Mother Bug. So I did put a slide together of an overview of the US in case some people have not been to the US or don't know about it. So the USA actually has an entire population of 330 million as of a couple of years ago, which is really about we'll say the entire population of the US is maybe about a fourth or a fifth of what we have in India. And you can see that heart disease is the leading cause of death still for people in the US. And the statistic they say is one person dies of cardiovascular disease every 34 seconds in the US. It's huge. So I had a whole bunch of research slides, but I really enjoyed what I heard from Dr. Deepak. So I'm going to come back to this and talk about my views, which are about the how we can take Ayurveda and Ayurvedic physicians to the global platform. So as I've been watching for the last few days, I find that there is a real need for education about talking to the audience. So you have to speak differently to the mainstream population who are your patients than you do to a group of allopathic doctors. My experience at BHU is that allopathic doctors still, if I say that I am from Faculty of Ayurveda, BHU, that's where I got my PhD, suddenly there's this condescension that, oh, you are just an Ayurvedic doctor. You people are not evidence-based. You're not scientific. And even if I tell them about Madhav Bagh or other things that are going on in evidence-based Ayurveda, they just don't want to hear it. And I am a nonsense physician. Someone told me I took the back door. And then I have to tell them, yes, but I'm actually an allopathic physician. And all of a sudden their respect increases. So learning how to talk with them about what we're doing by giving snehana, swedana, oral medications, which are actually dravyas. And I don't think we should call them medications because it sounds like pharmaceutics. We should say they are dravyas. What is a dravya? It's a substance that has a medicinal effect. And then we also have all of the purva karmas, but panchakarmas that have been introduced, right? And then the bastis and the virechanas that are done. And they shouldn't be called by the translation, they should be understood. We did not call coronavirus as crown microbe. We said the word is coronavirus, you have to learn it. People did not know the word coronavirus in January of 2020. So we should not say basti is enema. We should just say basti is basti, because basti is not an enema. It is nourishing. It is shodhana, it's purifying, cleansing, and it has profound effects on the immune system, which you cannot get when you call it enema. So learning how to speak to the audience is very important. Second, talk about the medicines in the language of the listener. So when I was hearing, it's a combination of Gokshur, Amalaki, and Haridra. Yes, those are the Ayurvedic terms, but my doctor friend, I shared a slide with him. He's a modern physician, and he said, what is this Gokshura? What is Gokshura? What is Haridra? And when I said Haridra is turmeric, well, why don't they just call it turmeric? Why are there so many names? And I had to explain to him that there are 30 languages and there's Sanskrit background and how Ayurveda has captured things over the, not just centuries, but millennia, 10,000, 30,000 years is the archaeologic evidence. In our Itihas class, we learn 5,000 years Ayurveda. It's more like 30,000 years. So we have a lot of different names for it, but we have to learn to find a name according to our audience. So in some places I say Holud. When I'm speaking in Bangla, I say Holud. I don't say Haridra. So this is there. Teaching the herbs as dravyas rather than as medicines is, I think, a better way for people to be invited to understand that you're not going to get an equivalent, because the pharmaceutical medicines that I prescribe have side effects. A dravya, when it is used as a proper chikitsa, proper medicine, should not have an ill effect. It should just have the medicinal effect. And there's a difference. I think all of you understand this. My PhD work is in Bhaishajya Kalpana and Rasa Shastra. So we always talk about the fact that it's not a medicine when the dravya creates a lot of negative effects. You have to get the posology, which is the dosage, the Bhaishajya Kalpana, which is the making of the medicine. And you can't just say, well, we're just going to put the botanical name, or we're just going to say it's a combination of these oral medicines. And that's what I was seeing. And for me, that's a disrespect of the brilliance of these medicines that each of you doctors is putting together in order to create a prescription for the patient. Number 4 is the heavy metals and toxicity nonsense, nautanki, which has been going on for the last 20 years. People don't even understand what is heavy metals. Yes, I'm not disagreeing that there are herbs producers who do have some contaminants in their production. Some are doing it because they're sloppy and lazy. Some are doing it because they don't understand the effects of the airplane flying overhead, which produces a fuel deposit of cadmium. Some of them do not understand the effects of the environment, but putting that conversation first and talking about heavy metals and toxicity and how Mother Bug does test for its dravyas that it puts, into the packages and gives to the patients, just accurately detailing that is going to be very important for coming out of India into the global market, because this is on their mind, because they have been told by the propaganda of herbal, people that that's what's in all medicines, and it's not true. Next is explaining in practical terms how Ayurveda cleans the gut. The gut is so important, the Mahashrotas, the Annavahashrotas, however you want to call it, and really teaching physiology to the modern doctors and to the patients, that the way that modern doctors see the gut is not how Ayurveda sees the gut. Publishing case studies in a way that's going to shift the understanding that Ayurveda shifts disease in a different way. Teaching the physiology of Panchakarma in a proper way. Emphasizing the rationale, the why. Every presentation I saw was amazing, but very few of the doctors talked about what the mechanism, what the rationale is, and why it's working. Why does the Basti work this way? Why does the Gokshur have such a great role in diabetes? Reminding the audience that Ayurveda is not just preventive and, swastasya rakshanam, but it's also for actual diseases. And then the last is the mental health. Every doctor that I listened to was on some level talking about the mental health of the patient and how they integrate that into care. And so I feel that if you can just have these emphases, you'll be able to take the usual talk that's on diet, lifestyle, heart disease, and stress management, all these keywords, buzzwords, and you'll actually be able to take it to a different level of understanding, where people will be able to take what's called lifestyle medicine in the USA and take it to the next level. Many of you know that I wrote a book on Dinacharya. It's a really nice book to introduce to people who've never heard about Dinacharya. I was going to share a few slides about the science of Dinacharya and clock genes and how they actually work scientifically. But I think in terms of the topic I was given, which is just to talk about the overview of how globally the people could integrate cardiology and Ayurveda, I think that talking about the science of Dinacharya or science of the different modalities, those slides that you saw on the side were about that. But my 15 minutes is now up, so I'm going to stop and take some questions if possible.
Thanks a lot, ma'am. There was a lot to talk about, but to just summarize things, you've actually shown the path to the physicians, to the practitioners in Ayurveda or integrative medicines, that how should be the communication in the way that your audience listens to you, how to demand respect for your dravyas and that line of thought that you are trying to implement. Even from small nitty-gritties like how to explain gut health, what is the importance of putting across your line of thought in a way that people understand the modalities, what are working behind it. So fascinating experience for all and each and every physician who wants to stand on a research platform and showcase his case. So yeah, this would be a great guideline for practical guidelines that have been given to our doctors. Thanks a lot for that. You should unmute, man. I think you are on mute.
Oh, I was saying, can I just share one slide so you know that I actually know some science?
Okay, sure. Yeah, please speak.
Yeah. So in my line of all the things I was going to present, one thing that is missing absolutely in my training in India from Ayurveda, and in most of the thousands of Ayurvedic doctors that I talk with and the young doctors, what we don't understand in India is the 7 deadly white foods. And I give an entire lecture on where does salt come from, and why NaCl is not the best salt, and why Saindhava salt. What is Saindhav? Saindhav is not just Himalayan rock salt. Saindhav is from the Sindh. To get that salt, it actually changes the entire conversation about hypertension. Sugar, it is not white sugar. You know, white sugar was actually invented how to take cane or date and make it into white sugar, was actually invented in India 3,000 years ago. Chinese came and learned, so many came and learned. But what we do today is give them white sugar. If we move to jaggery, it changes the conversation about heart disease. Flour, you guys are doing yava, which is barley, right? That's what you're advocating, which is written in the Shastras. If you go to Ashtanga Hridayam, chapter 6, Anna Swarupa, in the first section on grains. So I was going to go through the grains with you. You know, of course, I have way too much information, like many doctors who present. But when I teach the medical students, they have never seen this slide, which talks about how the Ashtanga Hridayam goes through the different categories of foods, right? And they've never seen it. They've never seen this kind of information of what happened with enriched flour. And by 1941, they understood that enriched wheat flour actually creates a loss that promotes beriberi, which is a vitamin B deficiency that creates so many problems for the people. And it creates heart disease. So there is so much that we can talk about in those 7 different whites, that if the doctors can learn about all of these 7, how they are being processed, and if we can stop patients from eating these kind of things, you know, the oil, the eggs, well, if you're vegetarian, not eggs, but milk, rice, and there's so much conversation about the processing of food and the evidence that the way that Indians are eating food today with the processing is a big problem. And the science is there. The Ayurvedic doctors are not learning it. And if they can counsel this, as I said, it changes the conversation on what patients are going to eat, and it completely alters their health. So I wanted to just add that science into my talk, and thank you for giving me that extra 2 minutes.
Thank you. Thanks a lot. So now we'll move on to our third guest for today. And our third guest is a renowned clinician himself, but he happens to be the chief medical head of Madhavbagh. He heads the medical operations, meaning there is a team of KOLs, meaning there is a team of a pool of scientific people who sit together and understand why and what needs to be done in terms of patient improvements. So they are the key opinion leaders, and they take ahead these scientific implementation of the treatments to improve each and every patient. So this team of KOLs, the zonal medical heads, Dr. Praveen heads that team. That's his day-to-day job. Apart from that, he is part of various developments in products and treatment modalities that happen day in, day out in Madhavbagh. He's also a research author himself, and he's a keen observer of Dravya Guna himself. He happens to be MD in Dravya Guna. So we are very lucky to have you, sir, on this platform with us. So please need a few words because of the time constraint from you for this session, so that we can move on to our next presenter. Thank you.
Yes, thank you. Thank you, Dr. Suhas, sir. Good afternoon, all. Respected Dr. K.K. Deepak, sir, Dr. Bhattacharya, ma'am, and all doctors. It is with great honor and pleasure to be the part of this remarkable International Ayurveda Cardiology Symposium. Since last 4 days, we come together to discuss and share research that aims to establish Ayurveda as a recognized and effective treatment option in a field of cardiology. Being a clinician and along with clinician researcher is a challenging task, and balancing these responsibilities require lot of skill. To all the clinicians and researchers present here, I salute your commitment to Ayurveda and your tireless efforts to bridge the gap between traditional wisdom and modern science. My best wishes to all the presenters and researchers who will be sharing their findings today. May your presentations be impactful and influential, leaving a incredible mark to the scientific community. Together, we can transform the landscape of cardiology and provide holistic care to those in need. I wish you all the best for your presentations. Thank you. Thank you very much, Suhas sir.
Thank you, Praveen sir. Thanks a lot for your words. So to take this exciting session, 7th session of the day 4 ahead, I welcome our first presenter, Dr. Archana Kele. Looking forward. Okay. Pallavi ma'am, please share the presentation. Okay. Archana ma'am, please unmute yourself.
Yes, continue.
Good afternoon, everyone. Myself, Dr. Archana from Nashik, Maharashtra. Today, I am going to present a case study of effect of Ayurveda-based Panchakarma and dietary modification on ischemic heart disease through improvement in GLA score with remission of DM. Next. Objective is a cardiovascular mortality has risen in the last few years and IHD is the most common cause. Lack of blood supply to the heart can often cause heart attack and diabetes mellitus is considered one of the strongest risk factors. This study aims to reduce the chances of cardiovascular mortality and increase tolerance capacity to improve quality of life and avoid disease relapse through the remission of risk factor, that is diabetes mellitus. Next, a 52 years male patient was hospitalized for MI in 2013 and diagnosed for DM and STN at the same time and also went for PTCA as SVD was found in CAG. In 2015, he again went for CAG as he had chest pain. In 2021, he again had chest pain on exertion and shoulder pain with fatigue. So he came to clinic and where stress test and HbA1c were done and Tudico with GLS was advised. From all these parameters, diagnosis was IHD with DM and HDL. Next. So the treatment given to him was oral medication with Arjunpat, Gokshur, Haridra, Amalaki, Ghanavati, pre-pack 800 calorie diet, which includes low carb, moderate proteins for 2 months, followed by 800 calorie diet chart, walking, yogasana, and pranayam as exercise. Panchakarma, 14 sittings of centripetal oleation, thermal vasodilatation, and per rectal drug administrations are performed during 7 weeks as per protocol. Next, treatment with timeline. From day 1, all regime was started. After day 30, 30-minute walk with strength training was advised. Anti-diabetic medicines were stopped. Antihypertensives were reduced. After day 60, antihypertensive and statin stopped. Panchakarma finished, but 800 calorie diet chart given and exercise continues. After day 90, trekking was also advised to him and all his allopathy medicines stopped. Only he was on aspirin 75. Next. So the results, his all symptoms reduced up to day 30 only. Weight reduced from 68 kgs to 59 kg. BMI from 26 to 23. Abdominal girth from 96 to 85. Blood pressure from 126 to 16, 126 by 69 to 110 by 71. Heart rate from 77 to 72. Next, the major improvement in following parameters are HbA1c reduced from 8.3 to 5.8, VO2 max increased from 23 to 36, EF from 49 to 55, stroke volume from 40 ml to 63 ml. Major improvement in GLA score, that is from minus 13.5 to minus 18.6, which is absolutely normal. GTT done at day 90 was also negative, and he was allopathy medicine free up to day 90. He was only on tablet ecosprin 75. Next, here are the before and after GLS reports. Next, Panchakarma plays important role in this case. 100 ml sesame oil was used for centripetal oleation, which reduces sympathetic overactivity, improves vascular tone, thus decrease myocardial load. Dashamul was used for thermal vasodilatation, which reduces systemic vascular resistance and afterload, which decreases cardiac workload and myocardial oxygen demand. 100 ml decoction of Gokshura, Haridra, and Amalaki was used for rectal drug administration, which has nitric oxide mediated vasodilatory effect, reduce oxidative stress and inflammation. Low carb diet may have led to appetite regulation due to negative calorie balance. This causes reduced insulin resistance and control glucose levels without the need of oral hypoglycemic agents. This reduced insulin resistance further help to decrease the glycemic relapse rate. So the discussion is cardiac ischemia occurs because of an imbalance between the myocardial demand and supply of oxygen. An increase in the coronary blood flow is the only option to meet this demand. GLS is a more sensitive measure of myocardial dysfunction. It is a superior predictor of outcomes, that is cardiovascular mortality in chronic heart disease. Since glycemic control is one of the prognosticators in ISD, significant reduction in HbA1c with achieving good glycemic control in this present study indicates good prognosis, as good glycemic control reduces endothelial dysfunction, thus reducing oxygen demand of the heart, ultimately reduction in cardiovascular morbidity and mortality. So the conclusion is significant improvement in GLA score and also glucose tolerance leads to betterment of prognosis in ISD patients. The dependency of conventional medicines was also reduced by this Ayurveda-based Panchakarma and dietary modification. Of course, further follow-up of this patient is still going on. Thank you.
Thank you, doctor. And our guests, if you have any questions, please.
No questions from me. Thank you very much. One point I would like to suggest to you, Dr. Archana, is not to read from your slides. We can read the slides. You just look like you were reading like a book. I think you have the expertise that you can talk about the patient the way you did in the first slides, but that discussion section and then conclusion, no need to read it. Just summarize it. Congratulations on such a good outcome for your patient.
Thank you, ma'am.
Yes, improving GLS by near about 3% is a very good and commendable job, because GLS less than -15 itself showing there is a huge imbalance between demand and supply. There is a huge ischemia at myocardial level, and improving from -13 to near about -17, 18. It shows this treatment really improves the myocardial blood supply of this patient, along with remission in diabetes. So good job, Dr. Archana.
Thank you, sir.
Okay. Deepak sir, do you have any question?
So good talk, very nice. She has handled very scientifically the way she was telling the physiological principle behind Panchakarma. Marvelous, very nice. All the best.
Thank you, sir. Thank you, Dr. Archana. And we'll move on to our next presenter, Dr. Sarita Patil. I welcome Dr. Sarita Patil. Pallavi, ma'am, can you please go ahead presentation? Okay, Dr. Sarita, your
Unmute.
time starts now.
Okay.
Yes.
Good afternoon to panel judges, doctor, my colleague and audience. I, Dr. Sarita, presenting here the cohort study on role of lifestyle modification in type 2 diabetes mellitus. Next. Type 2 diabetes is a big burden on health system of India. With the help of lifestyle modification, diabetes can be managed without support of oral hypoglycemic agent, and controlled is measured in HbA1c levels. Next. I presenting you the retrospective study of 20 patients which were treated at Nasik Road Madhoba Clinic. Out of 20 patients, 13 were male and 7 were female, between the age of 41 to 78 years. They are having history of diabetes from 1 to 20 years and were taking oral hypoglycemic agent 0 to maximum 3. These retrospectively selected type 2 diabetic patients are in follow-up with the clinic more than 1 to 4 years. Next. These 20 patients received 3 months stringent dietary modification guideline with support of Panchakarma procedure of Snehan, Swedan, and Basti once in a week for 3 months. After 3 months, Panchakarma procedure was scheduled once a month with diet and exercise guidelines. During this course, HbA1c, fasting sugar, PP sugar, and body mass index are monitored, and OHS support was reduced and stopped according to vitals. After 1 year, uh, exercise and diet guidance, disease education with counseling and regular monitoring once a month, sugar monitoring at home once in a week, HbA1c once in every three months done. These 20 patients are followed from more than 1 year, and we can see the result. Next, HbA1c is within control limit, that is below 7. Next, BMI is reduced and maintained throughout a year. All patients are not on support of any oral hypoglycemic agents. Next, as per Ayurveda, prameha is described in two types. One is sahaj and other is apathya nimittaj. Apathya nimittaj is type 2 diabetes mellitus, and it can be reversed by following pathya. Next, a reversal journey of disease is started with Nidan Parivarjan. So, regarding Prameha Hetu, as in this slok, we can see that our and behavior pattern. So, we do instruction based on this shloka. Laghu and Agni Nusar Ahar, that is low calorie and low carbohydrate in terms of modern diet. No milk or milk products, no new grains, no sugar cane product. Avoid kafakar means madhur sheet. So wheat and white polished rice is prohibited. Then Vihara. There is a special exercise instruction for diabetic patient. In Shushruta Samhita, first is Yojan Shatam Adhikam Vagachet, means daily 3.3 kilometer walking. Second is the Shushruta Acharya also suggested Niyuddha, Bahu Yuddha, Dvandva Krida. These all are combination of aerobic and compound exercise. So addition to walking, gym exercise, sports, and for elder people, green gym exercise are suggested. Third factor of Nidan Parivarjan is Vichar, that is stress and behavior in Vichar, that is stress and behavior. In Charak Samhita, Hetu of Vataj Prameha is Shok, and Pittach Prameha there is Santap and Krodh. With this reference, stress management is also important in diabetic management, which is achieved by one-to-one counseling of patient. Education of disease is also part of disease reversal, because Bishagvasya and Nyapak Rogi is important in Yashasvi Chikitsa. This reference is from Chikitsa Chatushpad. Next slide. Okay. So to conclude, Granthokta guidelines of Ahar, Vihar and Vichar is lifestyle modification, and consistent follow-up of lifestyle modification is required in diabetic patient to maintain glycemic control with a limit and stop dependency of oral hypoglycemic agents. Thank you.
Very clear, precise, and very self-explanatory presentation. Thank you, Dr. Sarita. So I invite questions, if any, from our guests.
Can I just make one comment?
Of course, sir.
He made a statement that you can be off all the drugs of diabetics if you do this kind of a intervention, which is an overstatement. So doing 20 cases and some male, females, and you can't make that statement. And that is the problem. Overstatement is sometimes it should be guarded. You should go and do a Cochrane database research and see the status of all CAM and other therapies, which has been already published by NIH about complementary therapies, and we find a lot confusing. So it should not be overstatement, should be avoided. That actually irks many of the people, those who are working lifetime in diabetes. Thank you.
This is a single centric study, is handling single center. In Madhavbag, we deals with near about 1,000 patients per month for diabetes reversal. And in these 1,000 patients, we have our own diabetic allopathy medicine tapering protocol. Or on that basis, we are taper down the allopathic medicines according to the protocol, and the SMBG, self monitoring of blood glucose, is also with this protocol. So we are in under watch of blood sugar levels for long term follow. So in this case, giving results for a shorter duration near about 90 days, 120 days is a very easy task, but sustaining that results for near about 4 years is a very difficult, and Ayurveda helps here through Dinacharya, Rutucharya, and Swastha Rutta. So lifestyle modification is the only answer for such diseases like diabetes, hypertension, and heart disease. So good job, Dr. Sarita.
Thank you, sir.
And I want to add that I don't think that it's an overstatement. I think what needs to happen is to help allopathic doctors to understand that the way we do things in Ayurveda is very different. You can look at all the evidence that's out there in the NIH and all the other places. They don't know how to do the kinds of things that Ayurveda is doing. And I have certainly seen reversals because the Shastras tell us that many people that are diagnosed with diabetes, according to having high blood sugar, we all know that Pandu, Arshas, Grahani, infections, inflammations in the body will produce high blood sugar. We also know that in physiology, that doesn't mean that the person has diabetes, yet they are diagnosed with diabetes. And when we reduce those factors, those, we can call them diagnoses of Pandu and Arshas and all, we resolve those issues. Suddenly their blood sugar does come down, and then they don't have diabetes anymore, because diabetes is a disease that is just about high blood sugar. It is not a disease that talks about the nidan of why the blood sugar was high. And when we can put that into our explanations, doctor, the kind of things that you discussed with the shlokas need to just be bridged a little bit for allopathic doctors to understand why the science that we are taught in allopathic medicine doesn't even allow for possibilities that we see clinically, that you see clinically, and that thousands of people see clinically. So I'm going to just politely say that you are not making an overstatement, but you need to bridge what you're saying so that the allopaths can understand why it is possible.
Perfectly. They need to bring that evidence to substantiate that statement. That's what I'm saying. And
Yes,
that can be got. If you do a large
So talking
study,
about evidences, Dr. Rahul has also shared one link in the comments, which shows us a study conducted by Madhubag, showing a study to understand the relapse of diabetes when people are reversed from diabetes. What happens post 1 year? So post 1 year, again, those same 82 patients were analyzed for the effect of metabolic changes that have happened in them, whether they relapse back or not. And 90.1% of them were still diabetic free even after 1 year when they returned to their original lifestyle. So doctors here tend to go on with those confidences, saying that, yeah, we have reversed our patients. So yeah, I just wanted to let you know about the evidences what Dr. Rahul had shared in the comment.
yeah. In fact,
Thank
we
you, ma'am.
published the work on reversal of myocardial infarction after yoga study. That is from AIMS, our department. That has been published. Those things should be published. That's what. And
Thank you, Suhas sir. Thank you, Praveen sir, and thank you, ma'am.
thank you.
So we'll move to our next presenter, Dr. Upendra Kulkarni. I welcome you, Dr. Upendra. Pallavi madam, can you please have the presentation?
Good afternoon, all of you. I am Upendra Kulkarni. Hello, I am audible.
Yes, yes, audible. Continue.
Yeah, my subject is role of Anuvasan Basti, Shirovirechan in the management of type 2 DM HTN with complication of frozen shoulder. Objective: diabetes is a chronic disease that occurs either when pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Common effect of uncontrolled diabetes and over time leads to the serious damage to the many of the body system, especially in nerves and blood vessels. Next one. My content is research question, case details, diagnosis, treatment, and discussion. Patient history: 50 years female, single case study, DM with HTN and with complication of frozen shoulders. She was at Parbhani. In 2010, she was diagnosed as a DM and HTN, and 2018 she was unable to flexion and extension of shoulder joint. So frozen shoulder diagnosis that time, and when she was come to my clinic, unable to climb the stairs. Next, patient first complication was palpitation, insomnia, nocturnal micturations, fatigue, joint pain, digestive problems, and shoulder pain. Parameters where height was 165 centimeter, height was weight was 58 kg, BMI 24, BP was 140/85, RBS was 179, abdominal girth is 97, and SpO2 98. And that time she was on medicine, allopathic medicine, that is Ecosprin tablet, telmisartan tablet, Grimistar, M14, calcium, and prednisolone. Previous investigation: HbA1c first time was 8.9 and triglycerides was 310 and RA factor was negative. That time I was advised that HbA1c, lipid profile, CRP, ABPM, and 6-minute walk. Diagnosis: Kafach Prameya with Ava Bahuka in Ayurveda, and that is the type 2 DM with the complication of frozen shoulder pain. Line of treatment: I was suggested that Panchakarma, oral medicine, follow up regular, and MIB pulse and SMBG. In oral medication, Banaba, Ashwagandha, Shunthi, Brahmi, Amalaki, and Nasya also local application of SMP Churna. Diet: 800 calories, low GI, glycemic index, high protein, low carbohydrate, and high fibers. In Panchakarma, Snehan, Swedan, Basti, Shirovirechan, and Virechana. Ashwagandha, role of Ashwagandha, Tikta Kashaya Ras and neuromuscular disorder and Vata Shamak. Banaba is a Kashaya Ras, again is decrease glycogenesis and regulate the lipid metabolism, acts like a synthetic insulin. Amalaki, dominantly Kashaya Ras, increase the sensitivity of peripheral tissue to insulin and also prevent the tissue of the oxidative damage. Haridra, Tikta Katuras, anti-inflammatory, it's activate the beta cells. Shunthi, Anulomak, Dipan Pachan, Vatagna. Brahmi is the Shita Virya. Then vitamin B12 and Shunthi, Marich, Pipali, local application with Vacha and Haridra, Marich oil with it analgesic and inflammatory, and it also improve the blood vessels, blood supply on the local application, and it relieves the muscle spasm. Diet: 800 kilocalorie in Madhobag is a Prameha diet box with low glycemic index, less than 30, high protein, low carbohydrates, and high fibers. In Panchakarma, Snehan, Swedan, Basti, and Shiro Virechana. And after that, the result of patient before 8.9 HbA1c, after treatment is 6.4, ABPM was elevated hypertension. After that, no hypertension is there. GTT first time not done. After that, GTT is negative. And before treatment, after treatment, only calcium tablet is all taken, and all other are tapering. This is the show result, patient of investigations. and discussion in Panchakarma, centripetal ovulation with neem oil. It improves some circulation with mobilized subcutaneous fat and deposit and reduce the insulin resistance, decrease the activity of the nerve that put the strength on the heart, reduce the increasing the peripheral resistance, thermal vasodilation, that is Dashamul Kvata. It induced
Doctor,
the
please
sweating.
move swiftly to your conclusion.
Okay, okay. In Nasya, particularly, I was taken the daily Nasya that nasal administration of Vacha Jatamansi teal oil. It congestion and clear the channel, and it also have the anti-inflammatory action. In Ayurveda, that says that Nasahi Shirosodaram, and in Vatas that Avabahuka, that in also the Avabahuka treatment is Nasya is the main treatment. A conclusion that type 2 DM with HTN in Panchasutri, that Panchasutri like the oral medication, diet, Panchakarma, yoga, and health monitoring. It is a single case study. That was the if I can large number of patients, that the accuracy of the result shows. This is our guidance. Dr. Rohit sir, Rahul Mandole sir, Bipin sir, Guru Dutta sir, Praveen sir, Omkar sir. Take a reference and thank you.
Thank you, Doctor. So I'll invite questions if any.
Dr. Upendra,
Yeah.
in your conclude part or result part, subjective improvement, patient having multiple symptoms at day one, but what happened with that symptom is not clearly mentioned. So you can conclude that part also in your result part.
Yeah, I was concluded that sir, frozen shoulder pain was decreased, not 100% decreased, but 80% was decreased that, and ABP, oral medication all stopped. Then ABPM, BP was negative, HbA1c also GTT negative.
So patient having only one symptom of frozen shoulder with pain.
No, frozen shoulder with no, unable to stretch the terrace. She now he या अभी क्या हो रहा है, वो पेशेंट यहाँ पे आके वॉक करके आ रहा है ऊपर, अभी एक मॉड्यूल चल रहा है, 20 स्टेप्स चढ़ सकता है, उसके ऊपर चढ़ने के बाद तकलीफ हो रही है उसको.
So you can monitor these symptoms, but you try to put in your presentation what happened with these symptoms. Okay.
Okay.
Okay. Good. Very good.
Upendra, there's a question in comments that the follow-up HbA1c was 6.4%. Then how can we conclude that the patient is reached an euglycemic stage?
Sir, all medication are stopped, and I was taken that time GTT test, and the result shows that GTT was negative. And last month I was taken again HbA1c, that is the 5.9, not mentioned on that slides.
Okay, so glucose tolerance test was done, and the last mentioned you. Okay, all right. So you should mention that anyways.
I would like to add that this was very nice, Dr. Upendra. It would be nice on your results slide itself if you put the dates, so someone can not have to refer back to the timeline, but know the date of the HbA1c and then the date afterwards. Adding the 5.9 is important, but also remember that there are different scales for euglycemia. 6.4% is less than 7.0. So even though some people say 5.5, 5.9, many of us know that those are all pharmaceutical based, and 7.0% is considered to be euglycemic. And maybe, have that bar there so people understand that it doesn't need to be so low to be euglycemic. Thank you.
Thank you, ma'am. Thank you, Dr. Upendra. We'll move on to our next presenter. I welcome Dr. Chaitali. Dr. Chaitali, can we have your presentation? Hello, ma'am, please.
Am I audible?
Yes.
So, good afternoon, all. Myself, Dr. Chaitali Bharat Pawar from Chhatrapati Sambhajinagar, company clinic head. My title name is Role of Gokshur, Haridra, Amalaki, Siddha Basti in patients with known case of CAD. Next. Objective is to access the role of Gokshur, Haridra, and Amalaki Siddha Basti in lifestyle and dietary modifications. That time a 54-year of old male patient came to our clinic with a history of STN since 2018. Okay, and he was having a symptom of unstable angina, we can say. He was having continuous chest pain and recent MI attack within 1 or 2 months. Recent MI attack of 6 months. Okay, next. He was suggested of CABG and he was unable to do the surgery. He was not convinced about the surgery. So he came to our clinic and okay. So he was having STN along with recent MI. His complaints was unstable angina, constipation and bloating. The major complaint was constipation and bloating with the unstable angina. That time we did a 6-minute walk test and calculated VO2 max was 9.98. His weight was 80.9. His abdominal girth was 103 centimeter. His BMI was 27 and diagnosis was done as CAD. So we did the treatment as oral medication, as Panchakarma. So here we focus in the Panchakarma therapy. We did give the Dashamul Kwatha, the Siddha Til and Siddha Basti of Gokshur, Haridra and Amalaki. And in the oral medication also, we give the patient Gokshur, Haridra and Amalaki Ghana. Okay, and Panchasakat Churna for the constipation and Hingavashtak Churna for the bloating and Arjun Kwat for the heart condition, for the betterment of heart condition. So after within 45 days, the patient was his vitals was as follows. Matlab, after 12 settings, his VO2 max was improved from 9.98 to 35.7. His abdominal girth was 93, weight was 76.5, and BMI was 25. So discussion is you can read. And next. Conclusion is that ki Gokshur, Haridra and Amalaki Siddha Basti is administered in the therapy to conventional treatment may improve the blood supply to the myocardium in the high workload and reducing the symptoms of angina with improving the quality of life in patients with CAD. So here are the references and yes, thank you.
Thank you, Dr. Jaitali. So I'll invite questions from our guests. So our first chairperson, Dr. Basmati, any question?
No question from my side.
Okay.
Questions, but I'm left wanting to know more about if you can explain, how things are working there. I think maybe I'm trying to think how I would do it, but how to do it so that a allopathic scientist or a lay person can understand exactly the beauty of what you're doing when you're doing the basti with these dravyas. I'm just thinking how to portray it. Yeah, if you have some ideas which are not yet full, maybe you can think about how to explain it. How would you explain it to your guru that what is going on with this basti? How is it working? Oh, I think you're on mute, doctor.
Okay, so the Haridra, the Amalaki and the Gokshur, what I observe is that these three are playing major role in this disease reversal within 45 days because Haridra, as we can see, it has antibacterial properties. It is best in wound healing too. And we can use it in every way. ठीक है मतलब we can use it in kitchen also because it is that much it plays major important role that we include it in our daily lifestyle too. So this is how Haridra plays a major role. Then we come to Amalaki. Now, if we can see our Madhav Prash, which is now available in market, it has majorly it has Amalaki, and it is good in our heart muscles, madam, improving our damaged heart muscles. Okay, so we can see that difference also. Sorry, my English is not that much fluent, but I'm trying. Okay, and
No, you're doing
left.
fine. You're doing fine. But कैसे ये अमलकी काम कर रहे हैं? ये liver या heart में कैसे काम कर रहा है? ये थोड़ा scientifically या logic rationale लेके उसको explain करना पड़ेगा.
Yes, yes. Then I can say कि रसवह स्रोतस, the मूल स्थान of रसवह स्रोतस is heart, and second is liver, and third फुफ्फुस सुद्धा. मतलब when in the neonatal phase, when the baby is born, and मतलब before within the 9 months, ठीक है, तर सगळ्यात पहिले मतलब सबसे पहले रस धातु से हार्ट की जैसे उत्पत्ति होती है, वैसे ही फुफ्फुस और मतलब लीवर की भी उत्पत्ति होती है. तो when the heart is getting damaged, within with heart, our fuffus and our liver will also get damaged. So it will work in that way. The Amalaki, the Haridra and Gokshur are working on the Rasa Dhatu mainly. So it will work in that way.
What you're doing is you're taking the embryology, which is also a science, right? And
yes,
you're
yes.
So putting that into a slide and saying the possible mechanism or rationale is that there is a connection in the embryology. This is actually the key to understand the Mulasthana of Rasadhatu, Raktadhatu, Mana Vahasrotas and all. So this is lovely.
We can go to the basic. Matlab, we can think it from the basic.
Yes, we have to explain these basics to the people. That's very nice what you said. Thank you very much.
Yes, thank you, ma'am.
Thank you, Dr. Chaitali. We'll move on to our next presenter. I welcome Dr. Bhavna Somani. Can we have your presentation, please? Okay.
Good evening, everybody. Myself, Dr. Bhavna Somani from Madhavak Shrirampu Clinic. My topic is role of Ayurvedic treatment, lifestyle modification, and proper diet in management of ischemia of known case of DM, CAD, dyslipidemia case series of 3 patients. Aims and objectives: silent myocardial ischemia is highly prevalent at about 1 in 4 asymptomatic diabetic patients. CAD is one of the CVDs having high prevalence. In India, 21.4% DM and 11% non-DM patients suffer from cardiac disorders. So, to assess the role of Ayurvedic treatment, lifestyle modification, and proper diet in management of ischemia of known case of DM, CAD, and dyslipidemia. Next, please. In here, medical history of case 1, 58 years male with known case of DM since 2012 with uncontrolled BSL. He had history of MI in 2015. He had underwent TTCA. Again, he had history of acute MI 12 days back, that is in August 22, and present complaints of chest pain, heaviness in chest, upper backache since 2 months, DOA grade 3 since 1 month. Next, please. In case 2, 54 years male, he has the history of hospitalized due to ACS in last month, and present complaints DOE grade 1 since last 6 months. Next, please. In case 3, 64 years male, he has history of hospitalization due to unstable angina in last week with present complaints chest pain and discomfort since 8 to 10 days, DOE grade 1 since 6 months. Next, please. We have assessed these 3 patients using these assessment criteria. Ma'am, next slide, please. We have taken case 2 and case 3 stresses. In the first case, as history of acute MI 12 days back, we have not conducted stresses. Also, his EF was 30% and GLS score was -11. Next slide, please, ma'am. These are abnormal lipid levels of case 3, case 1, 2, and 3. Next, please. So the common diagnosis was DM, CAD, IHD, and dyslipidemia. Next, please. We have treated, we had given the treatment with co-treatment duration of 3 months. In Ayurvedic treatment, Panchakarma, Snehan, Sweden, and Basti using these medicines. And for in oral medicine, we have used the polyherbal formulation of these medicines. Next slide, please, ma'am. Also, lifestyle modification on the basis of Ahar, Vihar, and Vichar, Nidan Parivarjan, Dinacharya Palan, Pranayam, Anulom Vilom, and Dirgha Shasan, each for minimum 10 minutes, exercise, meditation, minimum 15 minutes daily, and proper diet having these properties. Next slide, please, ma'am. Here we can see the improvement results. In 2D echo of first case, EF was initially EF was 30%. After 3 months, EF was 35 to 40%, and GLS score from -11 improved to -15. And after 3 months, when we have taken his stress test, on day 1, he has completed 15 minutes, and his VO2 max was 36.05. Next, please. Average improvements. Here we can see the improvements in all parameters, including weight, BMI, pulse, BP, mainly VO2 max 18.03, DTS 13.85, and HbA1c 3.14. Next, please. Here we can see the improved lipid levels, and GLT of all 3 patients also became negative within 3 months. Next, please. Medicine also tapered only in case 1. After 3 months, patient was on Ecosprin 75 OD. Next, please. Discussion, treatment principles and mode of action. Ayurvedic treatment, Panchakarma, due to Snehana, sympathetic overactivity reduces. Due to Swedan, as afterload decreases, decrease myocardial oxygen demand. Next, please. Due to Basti, the action of these 3 medicines, coronary vascularity reserve increases, so myocardial ischemia decreases. The oral use of polyherbal formulations, hypolipidemic, anti-inflammatory, coronary blood vessel relaxant, cardioprotective, helps to improve the endothelial function, anticoagulant, laxative, antioxidant, anti-hyperglycemic properties. Overall helps to improve the BMI, HbA1c, lipid levels, and also myocardial blood circulation. Next, please. Lifestyle modification, including Dinacharya and Nidan Parivarjan with regular exercise, pranayam, meditation, etc., helps in improvement in antioxidant level, oxygen consumption capacity, sleep quality, reduces stress and anxiety, thereby overall improvement in disease reversal. Proper diet with low carb leads to negative calorie balance, which makes use of stored glycogen, and it prevents the partial digestion and thus oxidative stress. Also, it helps in reducing the insulin resistance. Reduction in glycemic index leads to improved vascular health, as well improvement in lipid levels. Omega-3 fatty acids present in nuts exert cardioprotective effect. Also, high ORAC value has action antioxidant and anti-inflammatory, so helps in cessation of atherosclerotic plaque progression and also improves myocardial ischemia. So, conclusion, findings of our study suggest that Ayurvedic treatment, lifestyle modification, proper dietary changes show significant improvement in DTS, VO2 max, dyslipidemia, and HbA1c, thereby reduces the risk of cardiovascular events. It significantly reduces the dependency on conventional medicines, which is added benefit. Thus, it can serve as novel therapeutic option for treatment of ischemia in such patients. Further studies need to be conducted to create more evidence to support. Thank you. Thank you, Dr. Rohit sir and core Madhavak team, each and every senior. Thank you very much, and all colleagues.
Thank you, Dr. Bhavana. And I would like to invite questions, if any, from our esteemed chairperson.
Very nice presentation, Dr. Bhavana, showing improvement on Duke treadmill score, which is a good predictor of cardiac risk. Shifting patient from high risk to low risk is a very commendable job. So keep it up. Thank you very much.
Okay, so with due permission from our guests, I'll move on to our next presenter, Dr. Deepali Deshmukh. Welcome, Dr. Deepali. Hello, ma'am. Can you have presentation?
Good evening, all.
Good evening.
Myself, Dr. Deepali Deshmukh from Popoli Hospital, Madhobag. My topic is, can burger disease symptoms recover by Ayurvedic treatment? Why I choose this topic? Burger disease is a rare disease of arteries and veins in the arms and legs. Thromboagglutins obliterans name is there. Blood vessels become blocked. This reduces blood flow to the affected area. Blood clots may form in the blood vessels and gangrene develop, and amputation is the last option. In my patient, due to this disease, already bilateral leg amputated, so someone suggested him to go for Madhobak treatment. Patient is so poor, he is beggar, he is so financially weak. So I took his challenge and to improve the blood supply of him. So I treated him. Patient's discussion, patient age is 45 years male, history of smoking, tobacco, location Kalyan. In a year of 2017, patient complained of discoloration of upper limb and palm, pain in upper limb, itching over body, history of amputation of both lower limbs due to gangrene, diagnosed as Burger's disease. BP, heart rate, ECG was normal. Due to amputation of lower limb, unable to walk, he walked with hand support, and there was a pain in upper limb. Blackening of fingers was there. Discoloration of upper limb was there. Only with Ayurvedic medicine, we started the treatment. Since 2017 to April 2013, he is taking proper follow-up with us. Pain in upper limb reduced, discoloration improved. In Burger disease, no allopathy treatment is there. Only quitting tobacco is a treatment. So due to lack of blood supply towards upper limb, patient feeling pain, discoloration, and also due to amputation of lower limbs, we started only with the medicine treatment and diet. Within 1 month, patient follow-up, patient pain reduced. So regular follow-up done, and now discoloration and also improved. Means circulation of the limbs improved. Diagnosis: Burger's disease. Treatment information: diet and oral medicine started. Diet: stop the fried items, smoking, tobacco, quitting, milk products stop. Uh, 2 chammach go is added in diet. Oral medicines: in oral medicines, Arjun, Punarnama, Vachakara given time after meal. 3 months, liquid Manjista, Sarlathadi, is given per day, and Guri Harita Gokshur capsule as a discount for improving the inhibition given. As a soon is improve contact muscle, improve the circulation, use the AR in the Mandida Mahamandisadi Kada.
Dr. Deepali, I think we cannot hear you due to network condition. So, ma'am, can you please look at your network and just see if we can improve the voice?
I think we've lost her.
Yeah, I think we've lost her. Let us
Can
see
we
if
see the
if she
slides?
gets back again.
The slides.
Until then, yes, Praveen sir.
Can we see the all slides, further slides?
Okay. Yeah, yeah. Pallavi, please put on the slide again.
Yes, thank you. Next. Very good. Next. Thank you. Yes.
Okay. So until then, we'll move on to the next
Let's
presenter.
make some comments about this in case she doesn't come
Okay,
back.
okay.
Yeah, because I think it was quite compelling. I was looking forward to asking her what she thinks of the Ayurvedic discussion about Buerger's disease and what she thinks is going on from a Nidan or Samprapti perspective, other than the tobacco and all. We know about claudication. I would love to hear from Dr. K.K. Deepak on this. What is going on with the Ayurvedic perspective? The last slide, which thank you to Doctor for asking for it to be shown, that last slide visual was really outstanding. And I would encourage her to take this, develop it a little bit and submit it as an abstract to the Prague conference that Dr. Madan was mentioning yesterday. Because many of the doctors today have had case studies that are so beautifully documented. And if the timeline is shown properly and things are cleaned up just a little bit, fantastic. So I hope she comes back and that you share with her some of the feedback we have. And I look forward to seeing what any of you think about the Ayurvedic correlation to Buerger's disease.
I think vascular inflammation playing a major role in such cases. So in this case, tobacco, history of tobacco is playing a major role. And in Ayurvedic perspective, whichever herbs she used to treat this patient, including herbs which acts on Raktava Srotas, herbs which act on Rasava Srotas like Manjista and all, which plays a major role, and reducing inflammation through medicines, through dravyas, and along with lifestyle modification, which includes ahar, vihar, and vichar. And
but she didn't detail those, right? I mean, you're just saying it in general.
Yes, yes.
I want to know the specifics. I want to know what's happening with the Manavahashrotas. Every person that has an addiction like tobacco or alcohol or anything, there's a role of Manavahashrotas as well, which is the same Mulastan, right? So what is she doing to the Hridaya? What is changing? What is she doing to the vascular microenvironment? Fascinating.
Right. She can answer it a better way.
I think Dr. Deepali had also ensured that Gruth was there all the time whenever the treatment was going on. So the role of Gruth was also a significant, what I think, to the Sneha Pradhankar and to reduce the Rukshata that she observed. So
Great
I think,
point.
yeah, I think Dr.
And
Deepali
one
would be the
question,
yeah.
Do they use Madhavbag Grita? I mean, is it cow milk 100% or is there buffalo, right? I mean, we know all the issues about milk in India, right? Thanks to Amul and Mother Dairy. But those of us, I don't live in Delhi because specifically I wanted Goshala Doodh from a cow, Goshala, right?
Correct.
From a female cow, Gir cow. And
Yes.
so I chose Banaras simply because you cannot get Gir cow, Goshala milk coming in the, you know, with the container of milk. You can't get it in Delhi, Bombay, and Kolkata very easily. And so I moved to Benares, and it's one of the best ways that I improved my health by having this. So I want to know from her, is that Gogrita from Doodh to Dahi to Takra to Makhan and then, you know, Navanita and then to ghee? Is that the Gogrita that Madhavbag gives to patients? Or is she using something else because it's just part of Ahara?
So it is outside Gogruta. Gogruta is not our product.
So we have to ask this question to every
So
person.
I think Dr. Deepali is back with us. I don't know if she can hear us, but Dr. Deepali, there's a direct question to you. Is the Gogruth the way it's prepared, the way it's mentioned in the text, or is it something else? That's a question for you. And also the line of thought that you had, if you can hear us, you just elaborate on that.
You can unmute yourself. We are talking about you in your absence, Dr. Deepali. Oh, she's gone again. Okay, I think we have to move on then. Huh?
Yeah, we do have to move on.
And yeah, we appreciate her.
Thank you, thank you, thank you. So we'll move on to our next exciting presentation from Dr. Praful Yeshwantarao. Dr. Praful, I welcome you. Dr. Praful happens to be our IPD head for our Madhavbag Hospital in Koppal. So yes, Dr. Praful, please go ahead.
Thank you, sir. Good evening, all. Am I audible?
You are not
Yes.
well audible. I cannot hear you. There's an echo.
Hello?
Yeah, can you reduce the echo, Dr. Praful? Can you bring in more clarity in some way?
Is it okay now?
Go ahead and continue. Let's see if we can hear you, Dr. Praful.
My topic is the effect of Sansarjan on GLS in 7 days. I took 10 patients from my IPD, Nagpur Hospital. And, the question of my research is graduated diet from light to heavy can make impact on GLS. That means Sansarjan can make impact on the GLS. The number one patient is the 53-year male, known case of DCM, DM. His EF was 20% with moderate pulmonary artery hypertension. He hospitalized in Nagpur Hospital with dyspnea grade 2 bilateral leg swelling. Next slide. Second patient is 55 male CHF DM grade 2 diastolic dysfunction in EF is 30%. Again, same way he hospitalized in Nagpur Hospital with the complaint of dyspnea grade 2 chest pain and he had history of weight loss 4 kg. Next. 76 male known case of IST STM had a post PTCA. PTCA 10 years ago. Again, he had a chest pain. Again, he did CAG in 4th January 2023 and found triple vessel disease. So again, he hospitalized in Nagpur Hospital with same complete dyspnea and ghabra. Next patient. 67 male dilated right atrium, right ventricle, hypothyroidism. Same way he hospitalized with dyspnea grade 2, abdominal respiration, heart stool. Next patient. 72 male DCM, STM, his EF was 20, ischemic cardiomyopathy, degenerative mitral valve and aortic valve. Done routine checkup and found low EF. Hospitalized with the upper back pain, low back pain. Next patient. 16 male dilated right atrium, right ventricle, hypothyroidism. His EF was 48%, GLS 11.5. Hospitalized with mild chest pain and itching all over the body. Known case of hypertension. 58 male dilated right atrium, right ventricle, hypothyroidism. 34 GLS with GLS 13.6. Pulmonary artery pressure is 73 mmHg. Hospitalized with dyspnea grade 2, bilateral chest pain, bilateral side and unsatisfactory motion. 70 male DM HTM post PTCA. He had a history of coronary vascular event with inferior wall infarct. CAG done, PTCA done, and he hospitalized with the same complaint, dyspnea grade 2. Also, another complaint is deep urine and gastric distinction. Patient number 9, 65 male CHF HTM DM. It is CT angio in 11/9/2020. Calcium score was 534. EF 35 dilated LV and hospitalized with grade 2 constipation and occasionally giddiness. Number 10 patient 76 male DM HTN CAD and acute he had acute anterior MI CAG done and found adverse PTCA. EF 30% did PTCA and he hospitalized in Nagpur Hospital with dyspnea grade 2 chest heaviness and revealing situation. Inclusion criteria of this research is exclusion criteria is GLS above 16. Bedridden patients are excluded. Type 1 diabetic patients are also excluded. Who are not ready to follow Sansarjan curve are also excluded. Inclusion criteria GLS below 16 and who are ready to follow Sansarjan curve are included. Treatment, oral medications, Madhobag Ayurvedic medicines and their allopathy medicines. Diet, Sansarjan term, Panchakarma, out of 10 patients, 7 Panchakarma received heart failure reversal therapy and 3 received ischemia reversal program. These are the 4 days Sansarjan protocol. We just changed that 5 or 7 days Sansarjan protocol. Day 1, moong water, 100 gram moong water boiled in 1000 ml water. Quantity as per LVE it's around 800 ml to 1000 ml. Day second, we gave soup in each meal 200 ml 200 ml in breakfast, 200 ml in lunch, 200 ml in dinner. Third day, liquid moong khichdi, 200 ml in each meal can be eaten by spoon. Solid moong khichdi in day 4, 250 gram in each meal. These are the results. Patient GLS and EF is also improved. GLS of number 1 patient improved by 1.8, second 4.3. This GLS is 1 month before, and comparison is second month. Second patient 3.1, 1.2. Average GLS improvement is 2.02. These are the GLS reports improvement photos. Discussion. Sansajan term is administered the food orderly manner to based on the gunas of food preparation. The reason to follow Sansajan term is Agni substitution, Agni Stira, capable of digest to every food preparation guna. There is an anulomana of platters, urine, feces, and doshas. Also, we think that the complaints patient had is due to Margavarodjanya. With the diet protocol, we Sansajan Karma helps to reduce that Margavarodjanya Samprapti and GLS improved. Conclusion: yes, the Sansajan Karma and the Madhava treatment will improve GLS. Thank you.
Thanks a lot, Dr. Praful. An interesting take on the diet, the ahar that we have been talking about since 3 days. So I'll invite questions from our guests.
Dr. Praveen, you want to say something first?
No question.
My question for Dr. Praful is, if Shushruta could have a 2D echo, how would he interpret this global longitudinal strain measure that you're using, this GLS? What would Shushrut say about it? I'm having my morning chai sitting in New York. So you have the opportunity just for a minute to just think. But the reason I'm telling you is not to make it difficult for you. I'm telling you because if you can explain this, you have a great opportunity to take this beautiful case series and write it into a cardiology journal and introduce the beautiful concepts of Shushruta's anatomy and ideas about Hridaya. So even if you don't answer, think about it, okay? And please don't mind that I'm asking you this.
GLS at that time they increased.
Please proceed.
All right.
Yeah.
Okay. So we'll move on to the next presenter, if Dr. Praveen permits me. All right. So our next presenter is Dr. Gaurav Shelke. So he also happens to be from our courageous team from Kondali Hospital, and he's also there.
Yes. Am I audible?
So I think there are two different microphones anywhere near you. Please switch off one of them. All right, please go ahead. Yeah.
Okay. Good evening, all. My name is myself, Dr. Gaurav Arun Shilke. I am working since 2019 in Madhavbagh. So I am working now as the OPD head in Madhavbagh Hospital, Kondali. Today, I will firstly thanks to my mentors, my senior Dr. Praful sir, who motivate us to submit our presentation papers, and our operational head Praveen sir, our learning and development head Omkar sir, who motivate every time. Omkar sir is always being a friend to me, and he always guided me to choosing such topics. So today my topic is to study the effect of Vincol Churna in improvement of GLS score. Methodology I use that cohort study. Next slide, please. Now, first we see the overview of GLS. GLS is a myocardial deformation analysis that predominantly reflects the function of subendocardial longitudinally oriented fibers, which are most prone to ischemic damage and wall stress. Here we can see three types of muscle that are longitudinal, circumferential, and the radical. So we are here using GLS score to study the global longitudinal strain of longitudinal muscles only. So GLS is a simple parameter that expresses longitudinal shortening as a percentage, that is change in length as a proportion to baseline length. Next slide, please. Here you can see the difference and how we calculate the GLS, that is the relaxed end diastole length and contracted end systole, and that's why it's in always negative percentage ratio. Next slide, please. Cardiovascular disease remains leading cause of death and disability, responsible for 31% of all deaths. And as Madam said that in America also it is growing up to the certain marks. Global longitudinal strain, that is GLS, assessed by two-dimensional speckle trickling echocardiography, has emerged as a new method of assessing left ventricular function. GLS as an early marker of cardiac dysfunction may therefore identify people in the general population at particularly high risk of cardiovascular morbidity and mortality than the ejection fraction. Next slide, please. What causes low GLS? Some points I have mentioned that lower GLS was associated with older age, male sex. Females are not prone to the lower GLS. Males are more prone because of their lack of exercises or the different lifestyles, stressful lifestyles, higher systolic and diastolic blood pressure, higher heart rate, higher body mass index, that is obesity, we call overweight or obese persons, higher prevalence of ischemic heart disease, and higher proportion of smokers. Smokers generally produces carboxyhemoglobin that leads to dangerous ischemia, and higher cholesterol level that makes the blockages more and more vulnerable. Next slide, please. I have mentioned here some factors affecting the strain values. First, that is if after load increases, the strain over the muscles are decreases, and if the preload increases, strain also increases. Whether the thickness increases or LV mass increases, the GLS hampers to much the extent. And in myocardial ischemia, we have the difference between these GLS scores. And in myocardial contractibility, contractions are much more in synchrony or dysynchrony. That is, arrhythmia can change the GLS score. That's why in practical basis, we face the very many difficulties whenever there are pulse variations. Our technician, Dr. Raghvendra Singh, also always guide us that in such conditions, we have to first stabilize the patient. We have to first stabilize his pulse rates, and then the 2D echo with GLS score is actually possible. Next slide, please. What methods we have used here, that GLS were obtained in 88 patients of age between 35 to 65 years, which were residential in 7 days course of treatment. Study obtained on date of admission and after first follow-up, that is on the 30th day from discharge date. M-mode echocardiography was used, that called also image tracking, speckle tracking image algorithms. Vincol Churna prescribed as main treatment during hospital stay and at the time of discharge. Next slide, please. What was the result? Average improvement seen was 2.57%, and maximum it was about 12% in within one month. Next slide, please. Now we see discussion part, role of Vincol Churna. Vincol Churna consists of following ingredients like hingu, kalonji. The ingredients are in Hindi, but the Latin name I have mentioned here. Hingu, kalonji, jeera, pippali, shunti, bilwa, chavya, chitrak, vacha, amlavetas, punarnava, kokam, dadim juice, jambir juice, sendav, lavan, yavakshar, gogrutha, dahi, and curd, and water. All the contents are rudya in nature, and basically the main content was amlavetas, kokam, and jambir nimbu, and that are the contents of chaturangla or panchamla, which are the rudya in nature, which boost the myocardial muscles and which reduces the workload of the heart. Next slide, please. Now, aggregate result of Wincol Churna is Wincol Churna helps to improve endothelial dysfunction, thus it improves blood supply to myocardium. It reduces peripheral resistance by reducing atherosclerosis, thus improves in hypertension, especially in diastolic pressure. We see the cardiac heart generally provides the blood supply to all over the body, but when it receives the blood supply during diastole phase only. So diastole phase is very much important to receive myocardial supply, that is to reduce down the ischemia. It helps to heal damaged endothelium by its antioxidant properties. It improves metabolism of mans and med dhatu, thus helps to reduce calcium plaques in CAD and improves blood flow. Means it increases the endothelial dysfunction ratio. It reduces the endothelial dysfunction, and it improves metabolism of LDL and promotes HDL production through intrinsic mechanism that is called reverse cholesterol transport. It helps also to reduce weight and thus reducing cardiac overload. Next slide, please. Dosage we have prescribed.
Dr. Gaurav, we should move towards the conclusion.
Yes, dosage of Wincol Churna prescribed was 3 grams twice a day before meals along with the lukewarm water. The conclusion part was Wincol Churna can be used in improvement of GLS score, and also it can be very useful medicine in non-improved patients of chronic heart failure along with other palliative treatments. Thank you so much.
Thank you, Dr. Gaurav. So I'll invite questions from our esteemed guests.
Yes. Dr. Gaurav, did you check what happened with patient who did not prescribe with this Wincol Churna?
So we have to study that also, sir, because in first many patients we have seen the GLS is stagnant, not improving. So I have tried in these patients which have low GLS scores and which are not trying to follow in exercise or in diet manners. So I have tried to implement Wincol Churna compulsorily on all these patients.
Okay. Thank you.
Should I say something?
Of course, ma'am.
Yes, ma'am.
Dr. Gaurav, I want to ask you the same question. What would Shushruth say about the GLS if he were to interpret it in Ayurvedic language? Can you propose anything? You've had extra 10 minutes to think about it.
Actually, I am not capable to answer these, but I will try to answer some points. Sushruta was the was the group of people that can hear the quality of a symptom or hear the patient symptoms or signs precautiously. So Sushruth will say that the GLS is the nothing but the contractility of the heart. So if the symptoms or quality of life of patients are getting improved, then he will must say that yes, your GLS will be is improving on that manner.
That's very nicely proposed. I was thinking about the neurocardio synapse from the SA node, AV node, Purkinje fibers, right? So I'm talking physiology, electrophysiology, yes. And how the mind, we say man yahan hai, right? We don't say right. My mind is here. We say my mind is here, dono. So what's happening between the brain impulse to go down into that heart synapse, right? The cardio nerve synapse, and that neuromuscular junction that's there, which is unusual in the heart compared to skeletal muscle. What you are measuring in these men who you are saying that maybe it's less exercise, maybe it's less, I don't know how you can say, but the ahara vihara is not good. And so they are risking that contractility. There's a reason why that nerve is not inducing that contractility. And we have to think about the role of the mind. When a man shuts down his emotions because society doesn't want him to feel things, sometimes that connection to the heart, dil ka jo apne se jo ek spontaneous feeling hai, usko jab shut down karte hai, can that be a reason why men would have more logical intervention where you teach them to reopen their heart and process their traumas? trauma means, you know, whatever their childhood, main ye sochta tha for a boy, or main ye feel karta tha, this was my first love, usko shaadi nahi kar paya, fir main shut down kiya. Is that kind of stuff what is inducing low GLS scores? So we always have to think about the mind and the mental health and how society shuts us down. So I was thinking about this when I was listening to you, because your face, you are a doctor who is full of compassion. I can see it from your face. So I would ask you to think about the psychological or psychotherapeutic correlations of GLS in this very nice study that you're pointing toward. Thank you.
Thank you, Dr. Baspati. Can we move on to the next presentation, Praveen sir?
Yes.
All right. So I'll welcome the next presenter, Dr. Kirti Dagor. Dr. Kirti, can we have you, please?
Hello. Sir, she is not presenting now.
Okay. All right. So we'll move on to the next presenter, Dr. Sarika Mane. Pallavi ma'am, can you please help with the presentation? Yes, the slide is visible. Please unmute yourself and go ahead.
अनम्यूट नहीं हो रहा है
इकडे लावले की ऑलरेडी
लावले
मग कशाला मला सुद्धा नंबर पडतो
Dr. Sarika, you are on unmute and your slide is visible. Please go ahead. Yes, Dr. Sarika, please go.
Namaste all. I am Dr. Sarika Mane, HOD of Investigation Department of Madhava Hospital, Kondali. I am presenting my presentation, role of ischemia reversal therapy in improvement of GLS score. Next. GLS is myocardial deformation analysis. GLS is simple parameter that express longitudinal shortening as percentage. Next. According to some scientists, here to note that GLS is prototype in heart failure against LVEF. Next. Effect of PCI improvement in GLS score. Here some scientists research that PCI when done, there is GLS score is improved. Next. According to scientists, done 27 patient treatment assessment done of day of admission, day of discharge, duration of hospital stay was 7 days. Average age of patient is 35 to 60 years. Total 12 IRP ischemia reversal program therapies was conducted. Next, improvement done in 7 days. Residential treatment of patient. Average improvement seen is GLS score is 2.3. Maximum is 5.2. Average BMI reduced by 1.2. Total 12 therapies of IRP. Next, here is index of patient who given improvement in GLS score. Panchakarma done. Snehan, it helps improves circulation toward heart and reduces preload. Thus, it improves the cardiac output and gives oleation to all blood vessels. Swedan, thermal vasodilation, it helps to dilate blood vessels and removes excessive fluid and electrolyte like sodium and other toxins. Thus, helps reduces viscosity of blood and reduces peripheral resistance. Basti, per rectal drug administration. It is said that the treatment in Ayurveda as a medicine inserted through this route
has maximum absorption. It reaches directly to the target organ as compared to the oral administration. Next. Medicine used in IRP, Boksur, it has a diuretic property. It reduces cardiac load, improves intrinsic and extrinsic nitric oxide secretion in coronary blood vessel. Amalki, it protects oxidative damage to tissue, thus it acts as a cardioprotective and hypolipidemic agent. Haridra, it has an anti-inflammatory and anticoagulant, thus it reduces congestion and edema. Arjun, it improves tone of cardiac muscle. It is rich in flavidons and it also helps to improve contractibility of cardiac muscle. Next, conclusion, ischemia reversal program improved GLS score in 6 days of therapies. Ischemia reversal therapy can be used to reduce mortality in high-risk patient of some extent. Ischemia reversal therapy could be line of treatment in place where surgical interventions are contraindicated. Thank you so much.
Okay, thank you, Dr. Sarika. So before moving to the next presenter, any questions?
No questions.
All right.
No questions. I just want to appreciate that Dr. Sarika did do a attempt of explaining how Gokshamalaki, Haridra, and Arjun are working. I would love to see you split that slide and on this side put diuretic property and oxidative damage and all that, but on the right side talk about it in terms of Ayurvedic Dravya. The dono jo hoga, fir we can appreciate better what's actually happening in the Dravya side and not just on the interpretation in this pharmacologic kind of thing.
Thank you so much, ma'am.
Thank you. So let us move to our next presenter, Dr. Anuradha Deshpande. Welcome, Dr. Anuradha. You are good to go. Well, we have the slide, please.
Am I audible, sir?
Yes, audible.
Good evening, all seniors and mentors, and good morning, especially Bhaswati ma'am. I am Dr. Anuradha Deshpande from Pune, Madhobag Dairy Clinic. So today I am discussing the role of Tiktashir Basti in the management of hypertension. Tiktashir Basti, it is a specifically designed actually for Vata Vyadhi, but I used it in this hypertension. Why I selected this topic? Because hypertension is causing globally for risk factor as for 1 billion people, and it is about half of heart diseases and stroke-related deaths. Hypertension is called a silent killer because hypertension doesn't show its own symptoms unless and until we check it. So that's why I have taken this topic. Next, please. So case description. I took this case. This is a female of 58-year-old, and she is living in Pune. She was previously living in Thane, and she is having 2 daughters. They are in Canada. She visits them to and fro very frequently. So she was come to us. She was a little bit panic actually. She show us result that I have so many parametric changes. Every year I check up my daily, I do a regular checkup, and this year some parameters have changed. What should I do? I asked for as a doctor, I believe that whatever patient shows is not just a thing which is happening to her. What is happening is inside her also. So she was presenting with joint pain, headache, burning sensation, morbid thirst, Brahma, Vidaha. Vidaha means having hyperacidity with the pungent, sour and salt hot things. She was having craving for cold things. And on the day when she was having pulse rate near to tachycardia, like 95, her BP was a little bit raised, her random sugar was also raised, and her BMI was also overweight. It was 28.74. Next, please. She has brought HbA1c was 6.3 and her lipid report were also higher side. I advised her to do ABPM because I was about to confuse that she might be having hypertension, but as she was not taking any medicine, then she said that she was having psoriasis since 10 years. So we avoided that ABPM, ambulatory blood pressure monitoring. Then I with the Ayurvedic point of view, I studied with the Nidan Panchaka, and then I come to know that she is having Ruksha Bhojana, then Shita Alpa Bhojana, then she was having Prajagar because she was talking to her daughters there, and there is a time duration, we all know. And also as Ati Adva, she was having the Diva Swapna also, that means daytime sleeping, and she was having constipation also, and urine infection sometime also. Then in Ayurveda, Charkacharya has shown all these results in Vata Vyadhi Chikitsa Adhyay, that Lingam Pitta Vrute Daha Trishna Shulam Brahmam Tata Tamaha Katu Amle Lamanashai Vidaha Shita Kamita. She was having plenty of those symptoms. Next. Then I concluded my diagnosis as primary diagnosis as hypertension associated with DM type 2, precisely pre-diabetic, and also psoriasis. But she was not interested in other cases. She just wanted to get cured as early as possible. So it was challenge for me that I wanted one chikitsa line of treatment which could cover all this combination. So I first preferred medicines like Vata pacifier, Pitta pacifier, mild purgative, and the diet was like easy to digest food, Laghu Agni Deepak Ahar. I preferred very beautiful thing as Tiktakshir Basti. I loved it because the content in Tiktakshir Basti were Guduchi, Patol, Vasa, Nimba, and Kirat Tikta, and they were used, they were done decoction with the milk and water, and they had a Panchatikta Grita in it. And I was surprised that when I studied, I was thinking about this, giving her treatment about Pitta Vritta Vata. They, Charkacharya also has explained that you can use Kshirabastaya, and it gave me moral support and confidence that if I can use this, she can get cured easily. So next, please. Then in Ayurvedic aspect, why I choose all this content. So Guduchi, like Tinus Kodekadli, Cardifolia, Potolpatra, like Trichotosanthus decota, Adatode Vasica, Aza Directa Indica, Nimbus, Vatia Chirata Karatik, all these dravyas were having beautiful properties of adaptogen, beta blocker, diuretic, SC inhibitor, and calcium channel blocker also. So they were written in the shlokas various different uses, but these were important for me. Even allopathic aspect, it was shown that first you to use SC inhibitor, then or ARE inhibitor if BP is 140 or 90 above, then it is not going, then you have to use CCBs, and then if not, then you have to do further more investigations and everything. Next, please. Actually, as she was having psoriasis on her hands, so as I didn't do a BP PM, but I monitored her BP every day, before treatment and after treatment. Every day it was having good results. Like basically in diastolic, it was a variation from 7 mmHg to like 12 mmHg. The day one BP was, in conclusion, I can say BP day one was 138.92, it reduced to 129.78. Pulse rate was also 95, it reduced to 85. Random sugar was also reduced to very nicely 91. BMI also was reduced to 0.6 up to 2 kg. It was 1.9 kg in reduction. Next, please. So the conclusion is that Tiktakshir Basti is doing good is showing good results in prevention of in between hypertension or Pitta Vritta Prana. What I can say is that now I have taken 2 more follow-ups also of that patient, and she is showing consistent BP. Latest her BP was 130/80, and now she is ready for further like Virechana and other more diet and in everything. The important thing was that after 7 days, she was very much happy. What I observed was that her Vata, the chaya of her, like blackness of her face was reduced to her natural color. Her natural glow was improved, and that was good for me. And her, what I can say, mentality was being also stable. So I like these all things also to consider.
Thank you, Dr. Anuradha. Great presentation.
Thank you, sir.
I have to say, I really enjoyed that. Not only the way that you talked about it as a doctor, but the scholarliness by which you explained your own delight with Panchatikta, Kshaya Grit, and how things are working together, how you adapt to Basti. I really enjoyed the scholarly way that you did it. And once again, I will say to you that please write this and put it as an abstract in the Prague conference so that the world can get to it. It's high time that Madhavbag has a wide diversity of physicians that think as scholarly as you and also correlated with clinical. So thank you very much.
Can I say only 2 sentences, ma'am? First sentence is that this happened just because of Madhavbag, because Madhavbag has given us the platform to represent cases. This time Rahul sir personally told us, please present your cases, show that we can do many things. And the second important, that's why I did this. And the second important thing, just a different, your name, I like it. It is Bhaswati. And it is, I worked on Vyutpatti and Nirukti. So it is from Bhaha, means causing shine. So it's beautiful name. Sorry if you didn't like. Thank you. Yeah.
No, it's nice that you say it, because my sisters would say chamak, chamak, chamak to me.
Yes,
So
yes.
sometimes I'm too much chamak, but I enjoyed your chamak today.
Thank
So
you, ma'am. Thanks a lot. Thank you.
Thank you, thank you all, thank you all. So let us move to the next presenter. Thank you, Dr. Anurada. Dr. Sheetal, let us bring Dr. Sheetal More. Pallavi, can you help with the presentation? Can we have the presentation, Pallavi, ma'am? Okay, Dr. Sheetal. Yeah, we can see the presentation. Yeah, please go ahead.
Hello everyone, I am Dr. Sheetal More from Pune. I am presenting a case series. Actually, it's going okay. In this presentation, I have included my research question, case details, diagnosis, treatment, and conclusion. My research question is to evaluate the effect of weight loss treatment in primary hypertension. Next slide, please. Objectives to evaluate the effect of Ayurvedic diet modification, exercise, yoga, pranayama, and Panchakarma treatment in obesity. To evaluate the effect of fat loss on blood vessels. To evaluate the effect of counseling, meditation, and pranayama on stress reduction. As obesity is lifestyle-induced disease, it is depend on diet, lack of exercise, and stress levels. So we have to work on all these factors, and I try to evaluate all these factors. And obesity is related to raised hypertension. So I took this topic to evaluate the effect of weight loss in primary hypertension. Next slide, please. Patient medical history. I have taken 2 cases. One is 44-year male. Second is 44-year and 45 years old male patients. Both are friends. They are working in same IT company. One is known case of hypertension since 10 years, and other is known case of hypertension since 8 years. First case was having episode of blood pressure, high blood pressure in 2007, that is 180 by 110, and he is hospitalized for the same. And second has no hospitalization history. Both the cases having some complaints. First case has having complaints of palpitation, breathlessness on exertion, and weight gain since 5 years. Second is having complaint of weight gain since last 3 years and breathlessness on climbing the stairs. Vitals are stable. First patient was on allopathy medicine, tablet Stamlo 5 mg 1 daily, and second is on tablet Olmesar H 1 daily. I advise investigations, lipid profile, and ABPM. Diagnosis: obesity-induced hypertension. According to Ayurveda, obesity is a Santarpan Janna Vyadhi. Next. Treatment: I have advised Langan weekly once. Oral medication, diet, Panchakarma, and exercise. In Langan, weekly once I have advised moog diet and 1 day only salad and soup diet. In oral medication, I have added Namagugu, that is Triphala, Trikatu, and Trijat. All these medicines are Kapha Medagna, Agni Deepan, and Dhatwagni modulator. Then Vacha, Bibitak Pipali combination. Vacha is neuroprotective, anti-stress, bronchodilator, regulates the heart rhythm. It dilates the blood vessels, increase coronary artery flow, and reduce the load of heart. Bibitak is Anulomak, Raktashtapak, and Kafagna. Pipali is again Kapha Nashak, It is also works on rasa rakta and increase the rakta dhatwagni and improve blood formation, nourishes the nerves. I have included Kumari Asav, which is liver stimulant, antioxidant, improves the digestion and metabolism, reduces oxidative stress of tissue, and helpful in obesity and dyslipidemia. Again, for stress relieving, Brahmi, Shankhapushpi, Jatamansi, and Parsikyavani, which acts as an anti-inflammatory, antidepressant, which reduces the stress hormone like cortisol and production of neuroprotective and antihypertensive. Diet, I have given low carb diet, rich in protein, rich in fiber, 1000 calories diet. Diet contains some medicines also like dalchini, kulat, which are natural fat burners. I have completely avoided milk and milk products, rice, wheat, then more oil, maida, sugar like products. I have included in their diet salads, chia seeds, shatapushpa like ingredient, which help to reduce leptin resistance and natural hunger hormone secretions. In Panchakarma, I have given Snehan, Swedan, and Basti. Snehan with neem oil. Neem oil helps to improve circulation, mobilize the subcutaneous fat deposits, and protect skin from infections, allergies, and skin diseases. Swedan with Dashmul decoction, which channelizes the aggravated vata, promotes the metabolic waste through sweats, and when used as a thermal vasodilation. Basti with Kulatha, Nagwali Patra, and Meshashangi. This decoction scrap out fat deposits, reduce overeating due to reducing the leptin resistance, help to improve fat metabolism, thus help in weight reduction. Exercises, I have given all type of exercises like cardio exercise, strength training, yoga, and pranayam, which helps to improve heart health, and VO2 max, strength training for muscle mass and muscle mass building and fat reduction, and yoga to improve joint mobility and balancing of the body. Pranayama helps to improve their mental health and reduces the cortisol level, which again helps to improve the hormone balance. Next. In first case, I got result like weight before treatment was 93.9. After 3 months, it reduced to 78.8. BMI also reduced from 29.9 to 25. Abdominal gulf reduced from 109 to 90. BP reduced from 140 by 83 to 107 by 66. Actually, this first patient was not ready for hypertension treatment and ABPM, all these things, because he had history of hospitalization. I just requested him and convinced him for ABPM. His first ABPM was also nil. Day BP is 1110 by 69 and night BP was 93 by 57. After tapering his allopathy medicine, also his ABPM is negative. His day BP is 102 by 63 and night BP is 91 by 54. Lipid profile also improved. His day first lipid profile was 200, total cholesterol was 200. Now it is 168. Triglycerides was 153. Now it's 96. HDL was 40. Now it's 38. And LDL was 129. Now it's 111. And all allopathy medicines are stopped. In second case, this patient has less weight loss, but he's improving in his BP. His BMI was 32. Now it's 28. His AG was 104. Now it's 92. His BP was 130/90. Now it's come 110 by 70. Day one, his ABPM was done 122 by 77. The day BP, and night BP was 117 by 72. Second ABPM, actually I have missed it. This ABPM I have done just now before 5 to 7 days. It is now 132 to 94 and night BP is 114 to 70. And patient has also gained 3 kg weight from this. Its lipid profile is improved from total cholesterol is 196 to 167, triglycerides 226 to 133, HDL 37 to 45, LDL 114 to 96. His all allopathy medicine I have stopped. Now I am working with only Ayurvedic medicines. Results, as weight increases due to fat deposition in the body cells, oxidative stress increase, blood vessel elasticity is reduced, inflammation is reduced, endothelial dysfunction is there. With the help of Ayurvedic medicines, diet, Panchakarma, we gradually adiposity reduction is started. Oxidative stress is reduced. Blood vessels got their elasticity back. Cholesterol deposition also reduced. We can see in lipid profile. And due to normal ghrelin and leptin production, sodium excretion from the kidney is also improved. As a result, blood pressure also decreases. We can manage primary hypertension with the treatment of obesity also. This is a report of case 1 and second. Next slide. And this is report of case 2. Discussion.
I request you to move to the conclusion.
Yes, sir. Sure. Due to obesity, there is a higher prevalence of hypertension. There are many factors. Next slide, please. Obesity increases insulin-resistant inflammatory cytokinins, oxidative stress, renin-angiotensin activity, aldosterone activity, and sympathetic activity. So hypertension is there. Next slide. According to Ayurveda, we say Meda Vahanam Srotasam Vruko Moolam Vapahanam. So like kidney and momentum is a Srotas Mool of Medova Srotas. And when Medova Srota Drushti is there, obesity is there, and obesity induced lifestyle induced diabetes and hypertension like diseases are there. When we treat Santarpanjanya Vyadhi with Apatarpan Chikitsa, we got a result as a weight loss and also normal kidney function. So blood pressure also reduced. After 1 year of treatment, both the patients are stable. Next. Conclusion. It is observed that reduction in 1 kg of weight, systolic and diastolic blood pressure of the individual can decrease by 1 mm of Hg. Hence, the primary hypertension can be treated and reversed with the treatment of obesity. Thank you. These are my
Thanks a lot. Thanks a lot. So thank you, Dr. Sheetal. We'll move on to the next presenter. So the next presenter is Dr. Rucha Kulkarni. I welcome Dr. Rucha. Hello, ma'am. Can we have the presentation?
Hello, I'm audible?
Yes.
Yes. Good afternoon, everyone. I'm Dr. Rucha Kulkarni, Compliance Doctor at Madhavbag, Aun. Just passed out my UG education and joined here in Madhavbag. It's really honored to be part of this incredible conference. So my today's topic is efficacy of Ayurvedic management in low BMI diabetic patients. Next slide. Very quick about diabetes. As we all know, it's the 4th leading global cause of death by disease and really concern, especially in India. Next slide. So essentially, it's really needed to control this and have a good quality of life to any diabetic patient with Ayurvedic management with minimum side effects, which is my objective. Next slide. Now let's see the case details probably in a more digital way and paperless manner. So next slide. Here is the patient, 41 years, male patient, occupation is farmer, detected diabetes recently and has complaints of itching all over the body since 1.5 years, tingling sensation in hands, heaviness in limbs, nocturia, etc. And his father is diabetic. And he is on strong family history. Next slide. So some more case description as at first his weight was 57 kg, BMI 20.6, having sugar 188. In lab investigation, HbA1c was 10.8, C-peptide was 1.33. So he's not taking a tea due to anxiety since 10 years because he always thinks that he will suffer from the diabetes like his father and get always pricked by the insulin needle daily. So he gets stressed up by keeping this thought in his mind again and again, and this can be taken as one of the causative factor in this patient. So allopathic medicines are pioglitazone, glimepiride. He was taking regularly. Next slide. So diagnosis I have made as a DM type 2 patient with low BMI. Next slide. So before advising the treatment, I also tried to consider three categories like history, examination, and others, some food habits, and excess stress that we don't see in normal conditions. So next slide. So furthermore, to have a more fine-tuned approach towards our Nidan or Hetu and to have a precise treatment for this patient, I tried to categorize this in a way that family history, lifestyle, stress, habits, and family history plus stress. This patient comes under this category, family history plus stress. So for this, in treatment, I have, along with our oral medications, diet regimen, and Panchakarma, I use the combinations including Guduchi as a rasayana in oral medication and Shirodhara in Panchakarma for stress. Next slide. So the concept behind using this is Guduchi is a pramehagna, an anti-hyperglycemic effect, as well as has a rasayana effect. Rasayana effect maintains the equilibrium, metabolic activities in equilibrium, developing positive health and quality of life. It has also adaptogenic and hepatopancreatic effects. It deactivates the enzyme DPP4. And also Shirodhara, it has psychoneurophysio effects. It has sympatholytic effect and activates the peripheral skin circulation. So next slide. So this is the journey of my patients towards the diabetes reversal, starting from reducing his excess fat to reducing his HbA1c, with importantly stopping all the allopathic medicines with GTT negative results. Next slide. And the results are there is reduction in parameters of weight in HbA1c from 10.1 to 6.9, with stopping all allopathic medicines with GTT negative results. And in symptoms also, all the symptoms are subside after 3 months of treatment. Next slide. So this is how I captured the data for 3 months of the patient. So next slide. So in discussion, prameha is a disease caused by disturbance in kapha dosha, ambubha srotas and mutrabha srotas. Stress here one of the hetu and risk factor also causes rasa dhatu vitiation and leads to other srotodoshti also. So to avoid this, the treatment principle I have decided is one of the Shirodhara. So and Rasavani Dushyanti Chintanamcha Chintanat, it is the shlok. Next slide. Also in pathogenesis of prameha, kapha is the main dosh and kleda meda are main doshas involved. So gradually all other doshas get involved and can lead to dhatu kshaya. So along with kapha meda hara kledagna effect of medicine, rasayana effect we have to be selected here, because the rasayana effect acts at the level of dhatu, that is major structural components of our body, at agni, that is digestive factor, and srotasas, that is functional channels of our body. So the Guduchi by its rasayana effects reduces the orbalya and provides bala to the patient, and also is one of the ingredients of Medhya Rasayana, as Falashruti says, Ayu Pradani and Ame Nashanani, Balagni Varnaswarad Vardhanani, etc. Next. So in conclusion, I will say to improve the quality of life in such cases, finding the real root cause and advising a precise treatment is the key. And I also observe that we need to consider the impact of mind and body relations while advising the treatment. Next slide. So in way ahead with the patient, daily intake of ghee, then continue with pranayama, asanas, especially Surya Namaskara here. Then medicines which maintains metabolic activity in equilibrium, develops immunity against diseases, along with our pramehagna anti-diabetic medicines. And in Panchakarma maintains maintains good health in control. So I request these are the references, and I thank all the Madhav Bag and also Dr. Jyotik Sagar ma'am, his clinic head, and also Asha Lakaria ma'am for supporting me. Thank you.
Thank you, Dr. Rucha Kulkarni. Great presentation and a good new line of thought, we can say. So I'll just invite any discussions, if any, or we can move on to the next presenter.
Yes. Continue.
Okay. All right. So I think we are ending towards this session now, and we have our last presenter, Dr. Prakash Zondale, and we'll move on to Dr. Prakash. Dr. Prakash, can you unmute yourself, and Pallavi, can you the presentation?
Can you hear me, sir?
Yes. Before you start, Dr. Prakash, I'll just remind our chairpersons to consolidate their marks and send it across after this presentation. Thank you. Please go ahead, Prakash.
Thank you, sir. Welcome you all delegates in today's cardiology symposium. Today I am going to present my topic is a re-reversal of type 2 diabetes. Myself, Dr. Prakash Zondale, MD, NI Jaipur, and as a representative of Madhuba Clinic, Vajrabad, Nanded. I introducing my presentation with the slide of prevalence of diabetes with the prediction of increase by 40% by 2023. Means that these 40% people are at high risk. We all know that the diabetes comes with the multiple complication with the microvascular diseases. Means these 40% people are going to be at high risk in upcoming days. Next slide, please. To reduce this overburden, scientists are in the race to establish the theory regarding to get rid of this solution, and we come to the conclusion and found the many reversal concepts, including the intermittent fasting, keto diet, paleo diet, 2 meal diet, Dixit diet, and so on. Everyone approaches their way and trying to achieve their goal. So by this way, they achieve treat the disease and reduces the retinopathy, nephropathy, and neuropathy also. So we establish our own methodology and own multidisciplinary approach to reduce the type 2 diabetes, and here it is. Please next slide. For this study, we took 3 patients who having the known case of diabetes and hypertension with the raised HbA1c and hyperglycemia, also with the dependency of OHA since many years. We undergone the multidisciplinary approach, including the Panchakarma, which has the Snehan, Svedan, and Basti. Snehan includes the Nimba oil applications, Vedan with the Dashmul decoction, and the Basti includes the extract of Gudmar, Amalki, Daru Haridra, and Yashti Madhu. And along with that, the cardio is advised for each of the patient. As a result, after the 90 days, we found the tremendous weight loss in each of the patient with the controlled glycemic index in their body, and all dependency of the medications is totally reduced. Next slide, please. So how it is happens, it is the reversal of pathway in every person. We seen that initially they have the pre-diabetes situation, which includes the impaired sugar, next to the complaints which indicated by the hyperglycemia and raised micturations and polydipsia, tingling, numbness. And whenever the patient undergone the complication, he come to the clinic and started the reversal path and achieved their goal within a particular period. Next slide, please. After knowing this concept of the reversal, I want to add this slide because every organization jumped in the race of the diabetes reversal. Every gym trainer, yoga trainer, and so-called health coach also claiming that we are able to reverse the diabetes within a particular period without knowing the particular science. And here is the science. As per the mentioned in the Ayurveda context, that the diabetes and high glycemic and high calorie diet has a huge recepulus, and Nava Anna, Annapana, Guda Vaikruta, Dadhine, these all are high calorie intake and low sedentary job and low exercise, which is directly responsible for the raising sugar level and HbA1c. Next slide, please. So initially we took three patients. After the 90 days, they totally forget their diabetes, and they told to everyone they cured, and they hadn't any effect of sugar, and they don't want to come in the follow-up. And I'm totally reverse. Why should I come to the clinic? But after the follow-up of 9th month, I found. Next slide, please. After the 9 months, they totally gone through the irregular exercise, no regulations of the diet. They starting taking sweet, high carb, and no visitations to the clinic. Finally, results into the raised HbA1c, sugar, and again dependency of sugar, OHA or oral hypoglycemic agent started. So we educated them well that it is a lifestyle disorder and it is a metabolic disorder, and we again took them on a right track and started Panchakarma and guidelines regarding to the diet and exercise is again advised, and we found again corrected path of the reversal. So next slide please. Here this is we found the reduction in HbA1c in 90 days and again raised HbA1c in 8 months. So next slide please. So what is the remission and what is the reversal? So here with the support of direct trial, I want to mention here is that we have to use the word remission instead of reversal, because still if we not able to reduce the HbA1c for the longer duration, near about for a 1 year, till we can't use the word reversal for a particular diabetic patient. So as per the guideline of the direct trial, it is indicated that it should be period for greater than 1 year. Next slide please. This is a particular percentage I have given. Next slide. So I added this slide to boost our concept of low glycemic diet, high fiber diet, and low carb diet, because with the introduction of the restricted calorie diet, 46% participants in the interventional group in the direct trial, they have reduced their HbA1c, and in the control group in which the nothing changes was being done is only 4%. And after the follow-up of the 12 months, of 24% of the participants reduced their weight by 15%, and no such kind of results seen in the control group. Next slide. In which the quality of life also improved by the previous slide please. Previous slide please. Quality of life is much improved in those patients also who reduced their weight by 15% and having the follow-up of 12 months. And why we are expressing this reversal? Because in Ayurveda context, it is already mentioned that prameya is anushangik. If we get deeper into the concept of anushangik, as per the Chakrapani Tika, commentator of the Charak Samhita, explained that the anushangi means having continuous relapses. Even you are on the medication, it undergone relapses. It is a yapya vyadhi. Yapya is mentioned in the title, that if the patient is pathya sevanam alpa sukham, means if the patient is taking little kind of pathya, then it get cured. But alpena hetu ashu pravartanam, if little causative factor introduced in their lifestyle, the disease get reversed. So here we need to understand what is the concept of reversal. If we reverse the patient and he again introduce in the earlier lifestyle, he have greater chances to regain their original position. So next slide please. So here I want to claim that I
request you to speed up a bit, sir.
Yes sir, last two slides. And I want to categorize or need to include this patient in a particular guideline, that these patients should be before the 2 years from the diagnosis of diabetes 2 are having greater result as compared to the earlier. And those persons who having the good lifestyle, good prognosis, good follower, they are better chances of reversal. As earlier presentation author said that the mental health is also important. They have introduced the Shirodhara. Yes, good mental health is responsible for the earlier reversal. Less visceral fat is also reversible. So why I am here to express this topic, because we are continuously like this, all organizations are in the race to reverse the patient, but no one taking up the follow-up after the 90 days. So it's our responsibility, as we took definitely all our Madhavak taking care of this patient after 90 days also. And other organization after the 90 days, I think raising the sugar patient instead of the reducing patient. So conclusion of this study is that it is very important to maintain the weight loss till normal BMI with the continuous diet and exercise, even those who achieved their remission target. Thank you all. This is my nutshell topic. This is a few references given for the presentation. Myself,
Thank you, Dr. Prakash.
Thanks.
Thank you for the presentation. I'll invite any comments or questions for this last presentation.
I would like to say that I really enjoyed this presentation because he discussed, Dr. Prakash discussed the reality. In a couple of days ago, we had some presentations where the doctors presented that they showed the best case scenario, but that there were many patients who failed and they didn't discuss them. And the reason was because you want to show the best, right? So the reality is that patients think that they are cured. Now, we can have a debate about whether every case of diabetes is yapia or not, because I think many cases of diagnosed diabetes are actually not diabetes at all. They're just high blood sugar because of some other underlying nidan that is not discussed. And my PhD topic was on diabetes, so I had really thought about what's going on. And I appreciated, Dr. Prakash, that you talked about this in detail. I would love to have more discussion with you, and I welcome your email address so that I can discuss with you. But I do want all the other doctors here to think about what he said, that what is this false reversal when patients don't have the education of understanding what their ahara vihara and attitude and stress management do, and how you actually followed up. I have to admire you for that, because a lot of times I think you'd say, "Arey, patient nahi samajhte hai, chhod do." But you went and you said to them, "No, no, no, look, you are not thinking about it in a way that's going to help you long term. So as your doctor, let me show you that you had a galat chinta, and then you brought them back on track, and the Panchakarma helped them." So reversal, that's a very nice thing. So I applaud you for your perseverance and for your larger scope of vision. Thank you.
Yes.
Thank you. Thank you, Doctor.
Very well said, Dr. Prakash. That's why, though our treatments complete in 90 days, we took follow-up of these patients up to 1 year.
Yes, it is presentation for those who are non-scientific and just doing for a particular course and with the decoction or the soup and with some kind of smoothies. So it is not like that. It is bigger than their jug. So near about 12-month follow-up is essential for a complete reversal. This is the motto of my presentation.
Yes.
Thank you, Dr. Prakash. Thank you for the thought. So now I'll invite Dr. Rahul, who's with us. He heads our research. So Dr. Rahul Mandole, sir, I'll invite you to comment on today's presentation and the overall flow that we had today, exciting insights that we had. Until then, I'll also request our chairpersons to send me the marks so that I'll conclude the totals. Thank you, Dr. Rahul.
Sorry, I sent my marks already, but I sent them to whoever's number ends in 166. I think that's Dr. Who is it? I sent my marks to someone already.
Okay. I've received the images.
Okay.
Yeah.
Sorry for that.
Thank you.
Thanks a lot, Dr. Subhas. Thanks a lot, Bhaspati ma'am, and thanks a lot, Dr. Praveed sir. You shown a really the patience for, I think we are discussing into this session since last like more than 3 hours, and all the presenters, they presented really well. And what I can say is I think day by day we are improving the quality of the presentation, and I think I still remember the day one when we have started this conference, and I was a little bit worried because I feel as if I'm a parent of all the presenters. So, but I was a little bit worried, but the way all the presenters are presenting right now, I really proud from the inside. the few presentations what we saw today, especially the presentation of Dr. Sarita Patil, then Dr. Rucha, then Dr. Anuradha, and even Dr. Prakash presentation. These are the presentation. Actually, they are actually they are setting a new set of what they are aspiring other doctors also to achieve that the position what they have, the way they have presented today, and definitely they are going to take the Madhava to the next level. I expect all the presenters the way they are presenting here, if they can continually present their presentation in the various conferences, seminar, and all, definitely that will help them a lot. The Dr. Rucha especially, I'm really impressed with the way she presented today. I think it's not been more than 6 months she's into the Madhava, but still, I think yes, Dr. Rucha, you're here. So, since how long you've been into the Madhava?
Since 3 months, sir.
Oh, that's great. And who inspired you for this presentation?
Of course, Dr. Jyoti ma'am and Dr. Omkar sir and all others.
That's really incredible, and we want this kind of a generation, all the young generation, to come into this kind of evidence-based presentation. Definitely, you are a future of Ayurveda cardiology, and you will definitely make us proud on the all other platforms also. So over to Dr. Suhas. Sir, I hope we are ready with the portion of. You are still.
Rated the results, and the result is unanimous, although it's very neck to neck tie. Yeah, but I would like to inform all of you the names that have come up, and accordingly, Dr. Sarita Patil is the presenter for today, who has won the award for the best presenter. All the names that Dr. Rahul took and few others have just neck to neck 0.5, 1 mark behind, and fascinating presentations from all of you. But I'll congratulate Dr. Sarita for her superb presentation. So with that, I think I would also like to share, I would also like to ask Dr. Sarita her feelings for her excitement for now.
Thank you, sir. Rahul sir, Praveen sir, Gurudatta sir, and Suhas sir. All of you, thank you. मी माझे शब्द.
Of course, language no barrier. Language no barrier.
I was about to say that you can use your own words.
Bola.
Please go ahead.
हे जे माधवबागेने शिकवलेलं आहे की आपण सतत पेशंटचा फॉलोअप ठेवणं, रिसर्च हा भाग नंतरचा डोक्यात आलेला, पण पेशंटशी कनेक्ट जर चांगला असेल तर आपल्याला भविष्यात खूप चांगल्या गोष्टी मिळू शकतात. आणि फक्त पेशंटशी कनेक्ट आणि त्याची काळजी हे जे आपण जर कायम ठेवलं तर आपल्याला अशा प्रकारे खूप चांगल्या गोष्टी मिळू शकतात. याच्यामध्ये माझ्या 2 मैत्रिणी आनंदी मॅडम, सारिका मॅडम, आणि महत्वाचं म्हणजे ज्या पेशंटनी मला हा चांगला फॉलोअप ठेवलाय, माझ्याशी कनेक्ट राहिले, हे सगळ्यांमुळे मी आज मला हे छान मिळालंय. तर थँक्यू ऑल ऑफ यू.
Thank you, Dr. Sarita. And with this, we are coming towards the conclusion of this session. But yes, other sessions remain, and we are still excited to go ahead. So I'll thank Dr. Baswati, Madam, for her great presence today, for guiding us, along with also giving us few more insights as we go ahead. And I'll also thank Dr. Praveen sir to give us the guidance and guide us through these presentations. So, and of course, Dr. Rahul for his enthusiasm to move these pillars of National Ayurveda Cardiology Symposium in such a swift way. Thank you, Dr. Rahul. And I think we should conclude this session now. Thank you for your time, all of you. Thank you, all the presenters. We had a great evening.
Presenters and the delegates, I'm expecting you all to be there at 7 o'clock because we are having a valedictory function at 7 o'clock. And the most exciting and the most interesting point about the valedictory function is the chair professor, Dr. Jagdish Shrimat, the interventional cardiologist, is going to guide us for the 15 minutes, and he will deliver his session, his lecture on the how the Ayurveda clinical cardiology practice can be conducted with all the evidences. And I request all of you to be there right at 7 o'clock. It's Thursday. I know you all are free and doing nothing at home. So better you be there on a time. And thanks to all. See you soon.
Thank you.